It is currently unclear where parents or individuals should go to learn more about the interrelation and connection of tethered ties across the 5 areas of fascia, breathing, sleep, the nervous system, and nursing and birth. This documentary aims to help increase agency for every parent, practitioner, and wellness provider who views it, to better advocate for their children and themselves, and know more about the various perspectives, resources, and support available to them. Science is continuously progressing, and we hope the information provided here today helps as many families as possible to increase their well-being. For more information, please visit runningoutofbreath.org. Every year, there's an increase of Ankyloglossia in the USA.
Our job is to make sure that this nervous system is free of interference so that the body can function optimally.
Totally caught me by surprise. It's not anything that I learned in medical school. It's not anything that I read in research. Totally caught me like from left field.
Yeah, I think for me the most surprising thing was to see how truly quality of life, breathing and airway can be so affected by the coming together of fascia in your tongue and teeth and TMJ and your bite.
In the future, if they're not breathing correctly and they're sleeping with their mouth open and that continues, when they get to school age, it's not going to be noted before then until higher learning comes in and there's more demand on that child's brain.
So your tongue, your neck muscles, abdominals goes into your hip flexors, so your psoas muscles, your adductor group, and actually goes down and attaches right to the arch of your foot. So the arch of your foot is connected into the tongue and palate fascia.
One of the most interesting things that we've learned about this, and really this has just come to light in the last 10 years.
So when I tell you the story, you're going to understand that how everything is so interrelated.
When infants are born with oral tethered tissues like tongue ties, does that affect the tongue placement in their mouth? Does tongue placement affect their palate size and shape? How does the fascia play into all of this? Does their palate affect their airway and breathing? What are the effects of mouth breathing during sleep? How does a restricted airway affect focus and memory? If their airway is restricted, how is the body able to compensate? How does a restricted airway affect sleeping? How will the tension in the fascia affect the body? Where will they feel the tension in the body? Will all the resulting issues be near the tongue? What happens if the oral tethered ties are not released? What effect will an oral tethered tie have on the nervous system? What is the relationship between parasympathetic and sympathetic nervous system? What happens regarding the nervous system when someone doesn't get enough sleep? Does the body grow out of the tension? Can tethered ties affect nursing and chewing, or is it just breathing? Can ties have an effect on speech? Is everything traced back to issues in our breathing, sleep, fascia, nervous system, or birth and subsequent nursing? Our bodies are so intelligent that mild tongue ties, subtle narrowness in our palate, tension in the fascia, subpar balance of the parasympathetic and sympathetic nervous system, and difficulty nursing or chewing, or even lack of quality sleep are all independently inconsequential factors, better known as IIFs, that on their own may be considered insignificant. What about the relationship between shortness of breath and IIFs? What if we were living a life, running out of breath, and didn't have to?
I think a lot of that connection kind of came from my own personal struggles, seeing, starting off really with the dental aspect of it, with, my eating issues, my nursing issues, kind of went on into learning about kind of the structure of the mouth and the tongue, tongue ties, that went into kind of breathing and talking about breathing, and from there we really went to learning about fascia and tongue ties and how that's related to fascia, and how that impacts sleep. And from sleep we found the nervous system, so kind of finding all these things connected. Then as I talked to patients, we talked to patients, we found, and professionals, we found that this is like a common thing for these things to be connected, and a lot of people who have these issues are struggling kind of in all these different areas as well. So we wanted to create like a full perspective of this, and touch on all of these different points to show that there is an interconnection here. It's not just a one thing, and I think that's really where those 5 points come from. All right, so this is just a rapid fire Q&A. We're gonna do 5 sets of 3 concepts each, just to connect them in a few sentences, talk about the connections between them. The first 3 are nervous system, fascia, and ties.
Fascia is that system sitting underneath the skin. It's like spider webbing that connects everything all together. The tongue, the frenulum, is part of that fascial system. So if it's tight or if it's tethered, it's going to affect the fascia everywhere and create tightness and tensions within the body. And once it's released, it will release all of those tensions. That's why we see like hypertonicity in an infant they'll become more relaxed and their tone will normalize. Or in an adult, they might have chronic pain somewhere or neck tension or even down to the knee that will release when the tongue's released.
4 or 5 months after Patrick was born, it was misdiagnosed. There were a lot of symptoms, but we just kept being told that everything was normal. There was this symptom, that symptom, the next symptom. Oh, that's normal, that's normal, that's normal. And we tried to say, yes, perhaps that's normal and that's normal, but when you put everything together, it seems that there's more going on than just a simple that's normal and that's normal and that's normal.
Okay, so the first thing I want to ask you about, we're a pediatrician for 30 plus years. Can you talk a little bit about, some of the concepts like, fascia and chiropractic and nervous system, and how do those concepts kind of change over the course of your career, and like those ideas, was it something that was talked about? Was it something that you didn't talk about?
Speaking to fascia, nobody understands where those meridians are.
Fascia was something that has been ignored. It's something that surgeons just got through to get to the muscle or the organ, but the fascia is what holds a lot of the mysteries in the body. It's got a lot of nerve endings, and it's got cerebrospinal fluid, so it actually holds a lot of information. So with patients who are tongue-tied, functionally tongue-tied, you can develop a lot of plethora of issues in your body, and that's where my respect for fascia started to come.
So to talk more about fascia, can you talk about how, first explain what the fascia is for people who may not know, And then also explain how it connects like the whole body together and how it connects to ties.
Yep. So the fascia is that layer of tissue that sits right underneath the skin.
Mm-hmm.
It looks like, you can think of it as spider webbing, and it intertwines through all the organ systems all the way from head to toe.
Mm-hmm.
The frenulum is part of that fascial system. So it's all connected. When there's tension somewhere in the fascia, it's going to there's going to be compensations, there's going to be effects throughout the system. And if you think of when we're looking at a baby, they're small and tiny, right? So less area, and they're going to have more tensions. You're going to see it. You're going to see it more and notice it more. Also, like in toddlers, you may even see that they toe walk, or that they they extend their feet like this, because you actually can sometimes see the tension all the way down to their toes.
Oh wow.
Could you talk a little bit more about the nerve aspect of fascia?
Yeah, so the fascia, which I said is in dissections they've seen is like a full body suit we wear. So the fascia actually has nerve endings in them. And the fascia also has cerebrospinal fluid. So it carries a lot of even like stored emotions that the brain hasn't processed, or genetic information, or it carries sensory information. So when you go in, say for example, and do some orthodontic work, which is moving teeth, you're actually moving the fascia around each tooth. And so if you don't have a full understanding of what that fascia can do, you can have things like, for example, headaches from braces, or hold your posture differently or walk differently, because that fascia is not getting balanced.
Before the tip of the iceberg, so there's a lot more going on.
Yeah.
Yeah. So can you talk about, going back to the cranium, can you talk about how the cranium plays a role in this overall?
Yeah, so if we look at the palate, and we oftentimes, because that tongue got tethered down, remember we were talking about the palate and the formation of it, that palate the infant will be born with a high palate, a bubble palate, sometimes we call it high bubble palate, narrow palate, and when that happens, that creates a huge space. So even after the release, when the infant's trying to suckle, they have this big space here. So they're going to draw in more air, which might cause gassiness, right? It might cause clicking. And so in cranial work, we're dealing with all the bones are connected to one another. There is one bone called the sphenoid bone right in here, goes across the skull, that connects to almost all the other bones of the skull, but the palate, the maxilla, is part of that system. So when we're working with that cranial system, we can work to relax and improve the shape of the palate, as well as after the release, the baby's tongue's going to be lifting up and resting there, hopefully, in sleep, and their mouth is going to be closed, and they're going to be breathing through their nose.
So the palate is part of something called your deep front line.
Deep front line, yeah. We've
Yeah.
talked about that.
Okay. So you know about that, right?
Yeah.
So that deep front line is very much a regulatory muscle group. It's very deep, obviously, deep front line. It's really the core of our body.
It goes from like here down.
That's correct. Yeah. So it connects, so your tongue, neck muscles, abdominals, goes into your hip flexors. So your psoas muscles, your adductor group, and actually goes down and attaches right to the arch of your foot. So the arch of your foot is connected into the, tongue and palate fascia.
Okay.
So those muscle groups are very important in keeping your leg alignment, especially the hip flexor adductor group. So if there is an imbalance in that fascial line from palate, or if there's imbalance that causes the palate, fascia to malform, or the tongue tie, really, essentially. So the tongue fascia, then that can lead to imbalances in the muscle function left to right, because these fascia help these muscles communicate and work with each other to move your body as a unit.
Because one of the things we learned about in our research is that a lot of time when they do these the cadaver dissections, they just cut through the fascia and look right whatever's under it and basically ignore it.
Yeah, just move this stuff out the way, like this weird
it's
kind of
there.
spider-webby stuff.
It's like yellow and whatever.
Yeah, exactly.
I've seen the videos
Kind of
of it.
spider-webby, kind of matrixy looking stuff. Yeah. So they usually cut it. So thankfully, with our education, the dissection was good enough where we saw fascia.
Yeah.
It was not talked upon as a major biomechanical player.
I was gonna say
They're just
that,
like, see, this is fascia. All right, let's take a look at the muscles kind of thing.
Yeah.
The tie is the piece of string under the tongue is really made up of a lot of connective tissue. And that connective tissue is sheathed by fascia. And that fascia is, that plane of fascia is called the deep frontline fascia, which extends from the underneath the tongue right here. And in cases like your neck, TMJ, lungs, all the way down your pelvic floor, down the leg, the thigh, down to the toe. So it really revealed to me, even in my own body, that me having a tongue tie was affecting, my shoulder issues, my TMJ, my walking. And I started to really, really understand that fascia was something that had been ignored, has been ignored. It's something that surgeons just got through to get to the muscle.
Luckily, our lactation consultant, Caitlin McElroy, same last name, she came over to our house and instantaneously said, "He has a tongue tie." Okay. And she said, "When you get rid of that, all these symptoms are going to go away because you've taken away the root problem." When I say that there were problems with when he had the tongue tie, so his tongue couldn't properly undulate, and because it couldn't properly undulate, he was getting a lot of gas, a lot of acid reflux. He had some pretty bad torticollis, which we only really noticed when we were looking at pictures of him. His head was sort of off to the side, and well, why is that? Well, because the tongue was too tight and it was kind of pulling, the muscles were pulling. So once we got that released, I know that he's playing around right now, but hopefully you can see well enough that the head has straightened out. Gaining a lot more weight because if you think about it just in its simplest terms, if the tongue can't properly undulate, that first squirt of milk that comes down, it's going to make you choke. And I think that everybody can relate and say, if I'm choking on my food right off the bat, I don't want to eat more, regardless of how hungry I am. I don't, because I just had this traumatic experience.
So I started doing tongue tie surgery to help, get the tongue go up, my functional therapy, chewing and swallowing. And as I was doing it, patients would tell me these things. Their neck is feeling looser, their legs are extending more, and they're feeling better, and they're not clenching as much. And it was at first bizarre. I'd cut the tongue and their legs would straighten out. Very unusual, but I was open to it. And so I started talking to a physical therapist, and there's this lady, her name is Valerie Sinkus. And I said, "Hey, what's this about? You know about fascia?" And she's like, Of course, the tongue is connected through everything else. There's different fascial lines. And that's when I put two and two together. And your tongue posture is so important for so many things. The first thing tongue posture is important for is facial growth and development. When the tongue is up in the roof of the mouth, it's going to help to develop a nice, broad palate. It's going to help the jaws grow wide rather than narrow. But if the tongue is down, then you don't get that force that you need. And it's not only the force of the tongue going up to the palate, but it's also good chewing and swallowing. So given that we want the tongue to be up in order to breathe through the nose, in order to grow the face, in order to chew and swallow and have all these good functions, we introduce the concept of tongue mobility. And now, so the tongue has to be able to go up. If there's a string holding the tongue down, restricting the mobility of the tongue, then this is either going to impair tongue function such that you have trouble with chewing, swallowing, and speech, or individuals will compensate by lifting up the floor of mouth and the neck, by pulling on the fascia from other parts of the body. And in turn, these patients present maybe not so much with speech and chewing and swallowing problems, but rather fascial strains. So we have a host of testimonials on our website talking about the fact that the tongue is connected to the rest of the body through a system of connective tissue known as fascia. And when the fascia is too tight, when the tongue is restricted, patients have to compensate. And these compensations can lead to TMJ dysfunction, clenching, grinding, chest, diaphragm, all these types of issues.
Could you tell us why are ties considered bad? Like, what makes them a problem?
So, ties are bad when they restrict function. And so that's what we talk to a lot of parents about is, does this tie warrant a release, or is this something that the compensation, that we can get you into a compensation pattern that falls within a normal range? And so it's when kiddos or adults, their function pattern and their compensation pattern is very difficult. Would be, kiddos who are trying to nurse and they're chomping and chewing on mom. Obviously that's not great. With solid foods, it's kiddos who are really struggling with textured foods. Their hands are constantly in their mouth. And they're just really struggling to progress beyond a lightly textured or a pureed food to speech patterns that speech is effortful. We do see kind of as kiddos move through those elementary age into middle school, high school, that sometimes stutters are coming from a tethered, from a tongue tie, because the sound that they know they're going to struggle with, they're almost like flipping through options, and so that's the stutter, is that they're really hung up on the sound. So those are the things that we see kind of developmentally, and so those are the things that, if they can work with someone like a speech language pathologist or lactation consultant and find workarounds that work, and they don't have to have a release, fantastic. But when a tongue tie is too restrictive and it's those compensation patterns and they're still falling out of the realm of what is normal or socially acceptable, that's when it's considered bad.
So as we age, I suppose, kind of on the topic of kind of aging, and especially in terms of children, because I've heard a lot about kind of the idea of compensation, right? Where, as there's a tie that's untreated, as the child gets older, other things start to happen in terms of like compensating for that kind of restriction, I suppose. So is there a point where is it not worth doing a release because the body's adapted to a certain thing?
I would say, there are points, especially in younger individuals, you're more likely to intervene. But once you're a little bit older, 30s, 40s, your jaw development's kind of set, and you've learned some compensation patterns that kind of work for you. Maybe you don't want to rock the boat too much. But if you are having problems, clenching, grinding, body posture, voice issues, chewing, swallowing, acid reflux type of issues, no age is too late. So my oldest patient's like 83 years old, our youngest patient being at birth, right? So any age you can do it. If you see like a 3 or 4 or 5-year-old with a very significant tongue tie, it really pains you and you really want them to get treated. Meanwhile, if you have like an 80-year-old or, with the tongue tie, you can treat it, but if they've made it this far and they don't have any issues, then maybe it's okay. And so, those are two extremes, but, you might have someone out there in their 40s or 50s or, late teens and wondering if they should do this or not. And so the common things that are associated with restricted tongue mobility are things like clenching, grinding, neck and shoulder tension, okay? So if they have those symptoms, those are common symptoms of individuals who may be compensating for a tongue tie. Obviously, if there's an individual who has a tongue tie who's having chewing, feeding, speech issues, well, obviously you want to get treated. But what can be overlooked are those individuals who are compensating and presenting with more fascial pain or tightness issues.
Because your jaw is essentially a free-floating bone. It's connected to your skull with muscles and ligaments. But if there's any misalignment or tilt, either forward or back or left to right, because we have muscles that regulate our spinal column, if the spine is pulled 9 degrees sideways, it's because there are muscle groups that are pulling the spine out of alignment from your hips and your shoulders as well as your spine. Adductor group gets tight, pulls the knees inward, that will start to collapse your arches. Or vice versa is also true, where if the arches of the feet are flat, that can cause the knees to go inward, which makes your adductor group tight by just
the other way around,
association. Yeah, that's right. It's common, but not normal, we'll say, because your leg should ultimately be neutrally aligned, which means that the abductor and adductor are working in tandem to keep the leg straight. When you have a knock knee or an angling inward, like you said, is because that adductor group is being over-relied upon by the body, either because it's compensating for the abductor, not doing the job it needs to, or it's being put at a shortened length from something else up the chain.
Cool.
That's right, yeah, your knee hinge was disrupted, essentially. So when you have they call it idiopathic, which means that there's no known mechanism.
Okay.
If you have like a compression or a pinch or swelling, it's because your knee hinge is compromised because your femur bone and your tibia are not articulating properly. So if that inner thigh adductor group is tight, angling your inner thigh, or essentially your upper leg inward, and that lower leg stays straight as it was, then your knee is now going like this, which means you're going to compress that lateral compartment of your knee, which leads to pain and swelling. Because usually it's not the foot that causes it, it's other things up the chain, if you will, that force the feet to go flat, and then over time it just leads to issues.
I started to understand that the tie, as that piece of string under the tongue, is really made up of a lot of connective tissue. And that connective tissue is sheathed by fascia. And that fascia that plane of fascia is called the deep frontline fascia.
So this is what the tongue would look like if we could see it, like the full. Wow, that's kind of crazy.
Yeah, it's kind of crazy. I think it's important to know that the tongue has 8 muscles that we know of, that 4 intrinsic, 4 extrinsic, and it's got 5 up to 12 cranial nerves, which is really crazy, considering that we think of it just as the tongue. And that in traditional dentistry, the tongue has always been in the way. Like, we use a mouth mirror to pull it away from what we're doing, instead of saying, oh my God, like this tongue is defining this whole oral cavity.
There are extreme forces that those babies go through being born. Their cranium and their spine is very it's meant to compress in on itself, the cranium, in order to be born. These big fat heads coming out of a pretty small hole. And the cranium moves in many different ways in order to protect the baby. So to put it simply, it doesn't go back into the right alignment all by itself. The tongue is made up of 8 muscles so that it can move in all different directions. Just like any other muscle in the body, the hamstrings, the biceps, whatever, it has origin and insertion points. And the tongue muscles are attached here on your temporal bones, here on the interior of the mandible, like in the back of your chin, and here. This is a bone called the hyoid bone. Okay, it's a floating bone that sits right in front of your upper neck. Okay, all of the muscles are attached into those structures. Let's not forget also that we have the cranial nerves, again, that go into those muscles. The hypoglossal nerve is the main muscle that controls the tongue, and it goes right through your occiput, which is at the very base of your skull, which is cartilage. It's in 4 pieces when the baby is an infant, moves a lot.
So the tongue you can think of that as like spider webbing that goes from head to toe. And if it's tense and tight and tethered, then it's going to create tensions throughout the whole entire body. So therefore, compensatory strains throughout life that are unnecessary if it's released early.
We had it lasered. And we did all the exercises and came here and had them do the exercises as well. Things turned out a lot better. We noticed that the acid reflux started going away, that the gas was lessened by quite a good amount. Although it's always good to have Milocon on hand, just saying, Yeah, so there were a lot of issues that were solved in a short amount of time.
Let's talk a little about tongue ties. How did you learn about tongue ties?
Yeah.
We didn't learn about tongue ties till much later in my life.
Yeah.
Or at least, I don't know, 4 years ago or so.
Yeah.
Much later than, they tell you to do it, 0 to 3 months. So how did you stumble upon that? I know your son had a tie. I don't know
Yeah.
about your other sons, but yeah.
So when I tell you the story, you're going to understand that how everything is so interrelated.
Yeah.
So I had a baby, and he came 2 weeks early, and
Okay.
I didn't think much of it. And I had this huge belly, but when I had the baby, he was only 5 pounds. He was
Yeah.
tiny little thing, he fit on my hand just like this much.
Yeah.
And he was skinny, and he was so small, and everything else in there was just water. And it was kind of disappointing, because I was like, you know what? I can't believe I have a small baby, because everyone in my family is like 6 foot, big build. But anyway, I
Yeah.
was like, okay, let's see how it goes. The thing is, when the baby was born, and immediately, all the doctors were concerned, and they were like, oh, he's very small. He's not on the chart. We're going to keep him in for a few days. So I was kind of concerned. My baby did not thrive at all. And I really struggled. And then, he turned 1. And he turned 1, and he still would not drink milk. Then one day, my husband's mom, who is also a doctor, she came to visit us from India, and she was holding him. Now, he didn't speak. He's 1 year old. He did not say a single word. He didn't say mom. He didn't say anything. However, for some reason, he knew sign, like he would sign to me. And if he wanted to go outside, he would press his nose, because we had a slide outside, and that slide reminded him of the bridge of his nose. So he would press his nose to say, I want to go outside. Yeah, and he just made up his own language. He would, for example, to drink water, he would do this to his fingers. And he just wouldn't speak. He wouldn't speak. He wouldn't eat. He wouldn't drink. And he was tiny. When I say tiny, he was skinny, little, tiny guy. Then when my mother-in-law came to visit us one day, just out of the blue, she turned around to my husband and she said, your son has a tongue tie. And we were like, what are you talking? First of all, I was like, what the hell is a tongue tie? And then she was like, he has a tongue tie. That's why he's not eating. And I turned around to my husband. I'm like, what on earth is she talking about? And what is a tongue tie? And so she opened his mouth, and she told me, and she showed me his tongue, and she said, you see how your tongue is a V shape? My son's tongue was a pure M shape. It was literally M-shaped tongue.
Wow.
So this part, that's supposed to be a V shape, right?
Yeah.
So his was like this, and the whole tongue was pulled back. And so I don't know if you know the physiology of a tongue tie. The skin underneath, the kind of the ligament underneath is holding on so tight to your tongue that you cannot, you can't retract your tongue, and neither can you do anything with your tongue. So she said he has a tongue tie. And I immediately got him. I'm like, I'm taking him to the doctor. I want to know what this thing is. We had the tongue released. And can you believe, at like 16 months, my son took a pacifier for the very first time. The reason why I gave him the pacifier is because in Zambia, when the kids would not suck on a mom's nipple, we would give them a pacifier to learn how to suck. And so I gave him the pacifier so he would learn at least how to suck from a straw, because that was so difficult for him.
Yeah.
So he got a pacifier at 18 months. And then I bought him a sippy cup, which was easier to drink from. And he finally learned how to suck and drink milk from a sippy cup. And I think I gave that sippy cup to your mom as well for you.
Yeah, and I had the opportunity to kind of watch through one of your lectures from 2018 on
on kind of that, how you classify ties in terms of function. Could you just describe that to us? Like, how do you determine what tie needs to be cut? What is it? When is, at what point is something limiting function, I suppose?
Absolutely, yeah. So you should be able to lift up your tongue at least 50% of mouth opening. But if you're not able to get your tongue up because of a physical restriction, it's at that point that you may need to get it cut.
Now, switching over gears to the diagnosis itself. Diagnosis currently is kind of graded on a scale 1 through 4, and it's looking at where that frenulum attaches to the undersurface of the tongue. Well, the problem with that approach is it's not taking into account the functional capacity of the tongue. Regardless of where the frenulum is attached, is the tongue functional? Is it working the way that it should, right? Or are we seeing deficits in the way that the tongue is functioning, right? Because the problem with having a, grading system for diagnosis of tongue tie that's based on an anatomical structure that's there for everyone. We all have frenulum, right? But I think what parents are often exposed to is this idea that the frenulum itself is the problem. No. Lingual frenulum is normal anatomy. We all have a lingual frenulum. We have variation in where it attaches to the undersurface of the tongue, right? And certainly we are seeing, I think, a rather high degree of difficulty in babies latching and nursing appropriately.
But when a tie is detected in an infant, I think the earlier that it's released, the better.
So could you talk a little bit about how you classify, like, are there different types of tongue ties, and do they vary from just like how bad they end up being, like the impact that they have?
Yeah. So we'll go with the classification from the tip of the tongue, calling that class 1, and that's when the frenulum is very thin and connected to the tip of the tongue, and you'll often see or hear about a heart-shaped appearance of the tongue. And then the next stage 2, class 2, is when about 3 millimeters back, when it attaches from the tip of the tongue to the alveolar ridge, and that would be a class 2 tongue tie. Class 3 would be past the midline of the tongue, further back, and as the tongue tie goes further back, the frenulum is thicker, shorter, more taut. And then the 4th phase is way deep back in where it connects to the floor of the mouth.
Day off, and just make life just kind of difficult and uncomfortable.
Yeah. So how does this tension, like, as they go through childhood, how does it affect their, like, dental development? If you could talk a little bit about some common problems.
So, the roof of our mouth, there are genetic components. There's a lot of reasons why we have the shape of the roof of the mouth that we do. But we do know that one of the jobs of the tongue, certainly while kiddos are forming in utero and as we progress through life, all of us, our tongue should be up against the roof of our mouth, applying passive pressure to broaden and flatten the palate. And so if you have a short or a tight lingual frenum, that palate can really narrow because it's not getting that pressure from the tongue. And so we can see a lot of crowding happening. If a kiddo is unable to clean their teeth, it's called the oral toilet, which is gross but true, where the tongue has to go and clean the teeth. We see high incidence of decay. And again, obviously that mouth breathing that we talked about, that changes the structure of the face as well, and also dries out the oral tissue so that they're more prone to gingival inflammation and decay.
Yeah. Do you see, like, high arched palates as well?
All the time, yes. That's what I tell parents. In this office, we see a lot of high narrow palates because most of the kiddos who come through this door are restricted.
What we've moved to more frequently, in recent years, is a broader diagnosis: posterior tongue tie, a tongue tie that's beneath the surface. The frenulum appears somewhat normal. It's not grown to the tip of the tongue, but the tongue isn't coordinated in such a way that it resembles when a tongue is tethered in a true sense. And, well, this must be a tie that's posterior to the ventral surface of the sublingual tissue.
When the tongue is there, and the tongue tie is there rather, that fascia that's there is really restricting that movement. And so we'll see a lot of compensation patterns that develop because the tongue is not able to move the correct way. So like I said, the floor of the mouth sometimes really tense up. And we see a lot of the musculature doing a lot of the work that the tongue's supposed to be, because the fascia is basically tacking that tongue down. What I tell parents is that I'm one step of this. Just because I can release the tongue doesn't mean that the tongue is going to magically know where to go. I wish that was the case, but it's just not. Yeah. So really what we're looking for is I want the tongue to have been trained to the extent that it can. It will plateau if it is truly restricted, to have that strength and coordination so that once the tongue is released, we can kind of pick up where the restriction was holding us. Mm-hmm. And so that tongue posture can be, we're not starting from zero basically. Mm-hmm. So that's something that I definitely want. I want someone to have done that preliminary work to work on that strength and coordination, because sometimes, especially in older kiddos and adults, we really want to do as much strength training as we can, just to kind of optimize that release.
I guess I want to ask about myo and myofunctional therapy. What is that? How does it work? Why is it important?
Yeah, it's a very, very good question. So myofunctional therapy basically means targeted therapy for helping retrain muscles and fascia around the tongue, head and neck area. And typically it's either done by a dentist, but most of the times it's done by a registered hygienist who's taken additional training, or a speech language pathologist who's taken additional training. And it's really targeted. I think myofunctional therapy is the core of this functional way of expanding into airway health. Because if you just, for example, go get a tongue tie released, you probably will get all of your symptoms back again, or your reattachment, if you don't do this appropriate myofunctional therapy. I think myofunctional therapy is the very essence of this whole work. The upside is it's completely non-invasive. You really are able to cause some changes on a cellular level by doing these exercises in a mindful way. The downside is it does need patient compliance. So it isn't what, you can't give something to someone and say it worked. It does need patient engagement, patient commitment. It's very much like going to the gym. You have to go do it. And it's not a lot. It's typically twice a day, and it's probably 10-15 minutes of your whole day. But it is understanding how important that is.
The terminology of myofunctional therapists. So there are a lot of different providers. There's physical therapists, there's occupational therapists, there's myofunctional therapists. And if you talk to myofunctional therapy, they will tell you that that type of therapy is really best for children who are minimum of age 3 and up, because that type of therapy is where you need to be able to follow instructions and you need to be able to do your own exercises.
So basically in the last 15 years, there has been an approximately 2,000% increase in the diagnosis of tongue tie and the treatment. Okay. Mm-hmm. And I always, feel the need to say, again, so that people watching this don't just throw tomatoes at the screen and turn it off. I'm not anti-tongue tie. Mm-hmm. That gets to be controversial. They absolutely do exist. Mm-hmm. However, what I'm always trying to communicate, whether it's my patients or my students or the other doctors that I talk to, there are two kinds of tongue tie. Okay. One is that genetically shortened frenulum. The frenulum is the flap of skin under the tongue that anchors it to the floor of the mouth. Mm-hmm. And then there's a same thing under the lip. Okay. Mm-hmm. And there are absolutely times when that is genetically too short. The baby's born that way. and the tongue can't rise properly to breastfeed, or the lip can't flange properly over the breast tissue, and it causes a lot of issues. But unfortunately, what really is not identified or really even thought about, and it's not in the training of most lactation consultants unless they've specifically sought after that training. It's not in the basic training. It's not in the basic training of even the dentists that are performing the releases or most of the medical community about how structure plays into that. The other type of tongue tie, as I like to call it, is what Justin and I termed of neurobiomechanical causes. It's interference of the nerves and the muscles through that, what we call subluxation, the distortion pattern. So in a perfect world, and this is what I'm working towards chiropractically, is that baby would be assessed for that prior to going directly to a surgical intervention.
I've been working with a chiropractor right now, kind of in my area, and just talking about, she works with a lot of tongue-tied patients, or patients who have had a release or are going to have a release, especially infants. And I just want to ask you, she says she's seen a huge rise in ties. Do you have any kind of like, where's their ideas on that in terms of why is it happening?
For sure. So number one, I think that there's been less treatment of infant tongue ties in the past, and so now we're seeing the fallout from that from 15, 20, 40 years ago. And number two, I think that there's greater awareness now, which is a good thing, of how these ties are affecting different individuals. And I think that the chiropractors are now starting to look for it. And the more that you look for it, the more you start to see it. So I think that it's great that that these chiropractors are seeing these problems more. I have some colleagues who are actually doing research in head neck cancer patients, and they're seeing that a lot of head neck cancer patients have tongue ties and sleep apnea. And so when you have tongue tie, it causes clenching, grinding. You might bite on your tongue. You might have open mouth breathing, inflammation, and it's no wonder that now that we understand how to assess for tongue ties, we're seeing them in a host of downstream conditions and fields.
Yeah, I think for me the most surprising thing was to see how truly quality of life, breathing and airway can be so affected by the coming together of fascia in your tongue and teeth and TMJ and your bite. So I just had this really new understanding of how the fascia is a full body suit, and that for me was the biggest aha.
And it's by exploring the physical therapy, literature, and experiences that I was able to see that, there is something to this tongue tie and fascia thing.
I see. So, I guess, is this something that you think is looked at often in terms of when you say like you're encountering patients, with these sort of things, like if, for example, if I went to another ENT doctor, would they be seeing the same thing?
I really don't think so, unless they've seen our work.
And biomechanics was what I found in terms of the postural realignment therapy, in terms of, okay, well, this takes into account the whole body. We have all these muscles, we have this fascia, it should work together. Is why we have symptoms as human beings, because it doesn't. That was the question I went in and found the answer with this stuff. So
yes, so I've told several friends, because I have several friends that are having children or just had children, to get it checked. Make sure that your son or daughter does not have a tongue tie. If they do have a tongue tie, get it taken care of. As a quick anecdote, one of my best friends who had a son recently, when they were still in the hospital, I said, make sure the doctor checks it, and he did. But the doctor was very dismissive of it and said, oh, one of those internet things.
Mm-hmm.
Which, as you can imagine, sort of irked him, because he was saying, no, I know that it's a real thing. My friend, me, he's gone through it just now.
Mm-hmm.
And so you can see how dismissive certain doctors are. And I'm sure that doctors have been dismissive of, if you want to call it, new things for a long time. There is a lag period.
Yeah.
But hopefully we can get rid of that lag period and let everybody know that it's a very important thing.
Mm-hmm.
It needs to be addressed. The sooner you can address it, the better. I wish that we didn't have any problems with Patrick. We did. I don't want anybody to go through those same things.
Yeah.
It's not fair for us to have that knowledge and to not pass it along and say, please, if you have some of the torticollis and some of the acid reflux and some of the excess gas and some of these other symptoms, if there's something that can be done to fix that, if it's as simple as looking in the mouth and saying, your child has a tongue tie, why not do it? It takes such a short amount of time. The recovery, although it seems difficult in the moment, because I need to go into my son or daughter's mouth, and make sure that the tongue is properly stretched and this and that. It's tough because they're uncomfortable, but it needs to be done. And once it is done and everything is taken care of, it's over. So it's such a short amount of time for such a great thing.
So I want to talk a little about symptoms, and kind of what you see in patients with symptoms. What changes do you see, as people go through the process?
Yeah. So I see, my first awareness that someone's shifting is I will notice how they walk into the office. I'll notice how much more alert they are. I notice their eyes. I notice that the bags and dark circles are going away. I notice it shift into more gratitude. People come tell me that, I didn't have a headache today. Or, oh my goodness, I could lift more weights and not feel it in my neck, like I used to. Or I don't need a nap in the afternoon anymore. I have people saying, I can do the kind of activities that I stopped myself from doing. I'm doing that hike. Or I'm able to play more with my kids, so be more present. I have a therapist who would just zone out with every patient, and now she's like, my practice has changed because I'm just so much more present. I'm not sleepy through the day. So I just see, and that's all of the things on one level. On another level, you start to see more aligned bites, more aligned jaws, more developed faces, better neck posture. And as I've seen these people through their journeys in the last 4 or 5 years, almost never do they have gum disease or cavities, which is sort of like self-fixing itself as a byproduct, because they're breathing through their noses, keeping their mouth shut. And anybody who's investing at this level in themselves also cleans their mouth well. So I feel like as a byproduct, you get good oral health.
This is an example of the changes in a patient's sleep after a tongue tie release and palate expansion. In the after photo, RDI, AHI, and ODI went down significantly.
Our next 3 words are sleep, breathing, and nervous system.
All right. So sleep, as we know, is really important, that we get proper sleep to function properly during the day. And oftentimes people with ties sleep with their mouth open. Sleeping with their mouth open is going to cause apnea type issues. and they're not going to get proper sleep. So during the day, especially with children, many children who have ties that aren't released by the time they get to become school age, they're going to have difficulties with focus in school, and they may have a misdiagnosis of ADHD or ADD because they can't pay attention.
So I think that one of the most interesting things that we've learned about this, and really this has just come to light in the last 10 years, is that when people are asleep, the brain actually sort of washes itself. So the brain cells actually get smaller, and that allows kind of this fluid called cerebrospinal fluid to flow between the cells and carry out a lot of waste products that have accumulated. And because of this, we also know from studying diseases that getting good sleep is linked to a lower incidence of pretty much every disease, especially brain diseases like Alzheimer's disease. And so we think that good sleep is really important for the brain to do this kind of maintenance function. It seems like that, and this is happening in other parts of your body too. It's also a stage where like your heart is doing maintenance, your liver is doing maintenance, everything kind of gets reset to baseline.
When you're mouth breathing at night, you're not getting quality sleep. You're not getting your full, deep REM sleep, so that when you wake up in the morning, you're not fresh. Your brain is tired. And so what does that look like in a child when they get to school is that they are already tired. There's a new lesson being taught in chemistry and they're fried. So they can't take it in. You think if you look at the brain and you think the brain is filling up as a cup of water and it's right here, and then you were trying to give you more information and it just runs over. And what happens is the child will just deflect, sometimes back down into primitive brain even, and they're just like going la 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 la, thinking about the birds that are tweeting outside or what they're gonna do after school. And the teacher takes this as a child who is not intelligent or not attentive. Maybe they need to go see have a neuropsych eval for ADD or ADHD because they're not, but it's really not that. It's that they're not getting quality sleep and they haven't gotten quality sleep for years and they're unable to organize themselves to take in that higher learning.
You talked a little bit about sleep. Could you maybe expand a little more on like how sleep and breathing and tongue posture kind of relate?
Yeah, sure. So when we sleep to restore our body and take a break from the world when we're awake, right? So a lot needs to happen in sleep. You're supposed to renew, replenish, get all of the muscular activity to renew and replenish, and also your emotional activity. And that's where phases of sleep like REM and deep sleep are really important.
Improve sleep, I'm not sure, yeah.
Yeah, the slow wave stimulation. Yeah.
Okay.
Oh, but yeah, like
cool.
how do slow waves actually improve sleep?
Yeah.
So what these are oscillating electrical signals that in the brain, and they are generated when the brain goes into really deep sleep. And we think that these actually act as a signal that tells neurons to do the restorative things that happen in sleep. So this wave actually turns on genes. It's involved in kind of getting rid of waste products that have built up during the day. And these waves are really a signal that says you're deeply asleep, do these things. And so what we found in sleep labs is that by giving pulses of sound at the frequency of those slow waves, we can actually cause the brain to generate more slow waves. And there's some evidence that by doing that, you're making a stronger signal and you're helping the person sleep more deeply.
Yeah, so because of this twist we're seeing in the imbalance, that causes this twist, certain muscles are tasked to compensate. And compensating muscles are overworking muscles. They're doing more work, they're working around a certain muscle group, doing more work than they need to because they're overworking in place of whatever dysfunctional muscle your body's trying to work around with this twist. Yeah. So because of that, it's expending more oxygen than it usually would, which is depleting the oxygen stores even more that your body's building up throughout the day, which could lead to non-restful sleep or not going in that deep REM cycle.
I think the overall consensus is that open mouth breathing is less good for sleep quality. It's associated with a higher risk of sleep disorders. I think and it does seem like it is potentially associated with things like sleep apnea too. Just something about when you think of it, so it's very important when we're asleep. It's very important for the airway to stay open, and there's a lot of ways to mess that up. We normally don't think about it because when we're awake, we have a lot of muscles holding our airway open, and we're also very conscious of it. But when we're asleep, actually, the position that you're sleeping in, it's possible for a lot of things to happen that actually restrict the flow of air through your airway. And the thought is actually sometimes when people sleep in there with their mouth open, because of the position of the mouth and the tongue, it can be a less efficient way for air to get into their lungs, and they're breathing less efficiently. The caveat obviously is we generally breathe through our mouths when we're not getting enough oxygen through our nose. So sometimes the problem is not really the mouth breathing, it's probably like that they have nasal congestion or a problem with their septum, or potentially even some other type of apnea, and they're opening the mouth to breathe can be kind of a reflex to not having enough airflow.
What are some of the more long-term benefits or long-term impacts of proper tongue posture?
Yeah, sure. So the long-term benefits are, on a structural way, you get to develop your head and neck area in a more optimal way. So where in a wider way, the muscles are more relaxed, you have more space for all of your teeth, you have healthier gums, you actually age better, you also have less inclinations to respiratory illnesses, so many it's even hard to name them, like metabolic illnesses, heart issues, the ability to focus, have less brain fog, less fatigue, literally every single thing you can think of, because oxygen is our most important nutrient.
How can we make our brains work better? And when I went to grad school, I found this lab that was working on ways to improve human memory. I was like, wow, that's really cool. It turned out what they were doing was actually stimulating the brain to replay certain memories in sleep. And that is our natural process. It is how we form long-term memories. And by making the brain replay certain memories, you can make those memories stronger. So I got really involved in that research, and I found it really interesting. That's how I got into sleep.
Yeah, I was going to ask, do you not run into an issue of disrupting people's sleep and kind of like natural, sleeping and all that? That doesn't happen?
Yeah. Luckily not so much anymore. We actually found this out. So one of our very first research projects was we had this intervention that was supposed to strengthen memories by reactivating them. And we found out actually that it was weakening or erasing the memories. And it turns out that if you reactivate a memory and then wake someone up, it's not just that it doesn't work, it actually seems to kind of erase or weaken that memory. Wow. And we think it's kind of like pulling out a hard drive while you're writing a file to it, because that memory has just been made active, it's being replayed, and then suddenly you interrupt it, you kind of have scrambled that memory a bit.
Can you talk a little bit about bad sleep? What happens when we don't sleep enough or don't sleep properly, from a neurological sense, from a brain sense? What are the consequences of that?
Sure, yeah. So I think the things that kind of So missing out on sleep is bad for pretty much everything that your brain does. I think and you can kind of divide it into short-term effects and long-term effects. Okay. I think in the short-term effects, what you see even kind of when you have one bad night of sleep, what you tend to see is that people get very impaired at decision-making and reaction time. So that's very important for things like driving. Sleep disruption is a huge risk factor for car accidents. Wow. Also, people tend to get much more impulsive, interestingly, and they also seem to, in terms of how the brain is regulating the rest of the body, they seem to gain weight, they seem to be more likely to develop high blood pressure and diabetes, and they seem to just kind of be at higher risk of heart attack too if you continue having poor sleep for a long time. Wow. In terms of the long-term consequences of not getting enough sleep, what we see is that in people who are getting really bad sleep or insufficient sleep, they have a higher risk of dying from pretty much everything. We think that a lot of those deaths are probably from things like heart disease and strokes. And what seems to happen is that it seems that one of the important things that's happening during deep sleep is that it is taking some pressure off the cardiovascular system. So your heart rate drops, your blood pressure drops, and it seems like that's really important. When people don't get enough sleep, or that sleep is bad, the regulation of that system gets messed up. You see increases in blood pressure, and that then seems to lead to these other diseases.
For the patients who have been assessed for a tie and have been confirmed for a tie,
Yep.
what are some like trends that you may have seen throughout the years about their like mouth development, like their teeth or their jaw?
Yep. So the vast majority of the patients I see in this office are infants, but I do treat toddlers and older kiddos, teenagers, and adults. And so what we really do see is, particularly in maybe like kindergarten age kids, is we do see a lot of wear on their front teeth. And so these are kiddos who mom and dad say, no, they're not sleeping well. They're spinning around in their bed at night, and we hear them grinding their teeth. They're really light sleepers.
When we are mouth breathing, oftentimes we don't get good REM and or deep sleep, because the fact that when you mouth breathe at night, your tongue can fall back at the back of your throat and obstruct your airway in a physical manner. And so when that happens, you're not getting the kind of sleep quality because your body's trying to now prevent this tongue from falling back on your airway. And our bodies are very smart. They're meant to protect us. So a way to protect us could be to clench or grind your teeth, because you literally move the jaw and the tongue forward, Or it could be to wake up, because when you wake up, you might go to the bathroom, you might not fall asleep, but you got the tongue out of the back of your airway. Another way to do that is if you toss and turn all the time, which then leads to poor sleep, is you're basically trying to not choke on your own tongue. So having limited tongue space, tongue ties, can lead to disordered breathing at night.
Can you talk a little bit about bad sleep? What happens when we don't sleep enough or don't sleep properly? From a neurological sense, from a brain sense. What are the consequences of that?
Sure. Yeah. So I think like the things that kind of you. Sorry, let me start over. So missing out on sleep is bad for pretty much everything that your brain does. I think and you can kind of divide it into short-term effects and long-term effects. I think in the short-term effects, what you see, even kind of when you have one bad night of sleep, what you tend to see is that people get very impaired at decision making and reaction time. So that's very important for things like driving. Sleep disruption is a huge risk factor for car accidents. Wow. Also, people tend to get much more impulsive, interestingly, and they also seem to, in terms of how the brain is regulating the rest of the body, they seem to gain weight, they seem to be more likely to develop high blood pressure and diabetes, and they seem to just kind of be at higher risk of heart attack too if you continue having poor sleep for a long time. Wow. In terms of the long-term consequences of not getting enough sleep, what we see is that in people who are getting really bad sleep or insufficient sleep, they have a higher risk of dying from pretty much everything. We think that a lot of those deaths are probably from things like heart disease and strokes. And what seems to happen is that it seems that one of the important things that's happening during deep sleep is that it is taking some pressure off the cardiovascular system. So your heart rate drops, your blood pressure drops, and it seems like that's really important. When people don't get enough sleep, or that sleep is bad, the regulation of that system gets messed up. You see increases in blood pressure, and that then seems to lead to these other diseases.
Can you talk a little bit about bad sleep? What happens when we don't sleep enough or don't sleep properly? from a neurological sense, from a brain sense? What are the consequences of that?
Sure. Yeah. So I think like the things that kind of you. Sorry, let me start over. So missing out on sleep is bad for pretty much everything that your brain does. I think and you can kind of divide it into short-term effects and long-term effects.
Okay.
I think in the short-term effects, what you see, even kind of when you have one bad night of sleep, what you tend to see is that people get very impaired at decision making and reaction time. So that's very important for things like driving. Sleep disruption is a huge risk factor for car accidents.
Wow.
Also, people tend to get much more impulsive, interestingly, and they also seem to, in terms of how the brain is regulating the rest of the body, they seem to gain weight, they seem to be more likely to develop high blood pressure and diabetes, and they seem to just kind of be at higher risk of heart attack too if you continue having poor sleep for a long time.
Wow.
In terms of the long-term consequences of not getting enough sleep, what we see is that in people who are getting really bad sleep or insufficient sleep, they have a higher risk of dying from pretty much everything.
Okay.
We think that a lot of those deaths are probably from things like heart disease and strokes. And what seems to happen is that it seems that one of the important things that's happening during deep sleep is that it is taking some pressure off the cardiovascular system. So your heart rate drops, your blood pressure drops, and it seems like that's really important. When people don't get enough sleep or that sleep is bad, the regulation of that system gets messed up. You see increases in blood pressure, and that then seems to lead to these other diseases.
Is there, I don't know if you've gotten to this stage in your research, but is there a kind of an idea maybe if this can help with memory loss or things like that, and amnesia and that sort of thing?
Definitely, yeah. I think one of my colleagues actually just published a study showing that this technique of reactivating memories in sleep could help especially older adults. She did some preliminary research suggesting that they could help older adults like remember stuff about family members, which I think is something that they really struggle with. I think this is definitely one of the things that kind of happens as we get older is that our sleep gets less good, and there is a lot of and that slow wave mechanism that I was talking about, also they start to kind of break down.
Absolutely. Is there a way that this kind of stimulation of these slow waves could maybe even help to restore some of those memories that are being weakened or like you mentioned, erased by sleep apnea or other waking up in the middle of the night, that sort of thing?
Yeah, I think it's a good question. I think with sleep apnea, it's tricky because you have a really strong environmental cause. Like you need to wake up because if you don't wake up, you will die.
Yeah, exactly.
Now the question, I think the interesting way that this could help is that people who have sleep apnea, they are going into the slow wave state sometimes, and can you kind of compensate for the fact that kind of maybe their sleep is not very efficient by trying to make their periods of undisturbed sleep more efficient?
Yeah.
So I'm thinking about this more as like you're treating the sleep apnea, maybe you have a CPAP, it's working 75% of the time, but your sleep is still a little bit disrupted.
Yeah.
Can we compensate for that by making your good sleep more efficient?
Yeah.
And I think in general, this is kind of where this is. So it's very similar to what's happening in aging. We're trying to really make the sleep more efficient. We also think that this could help people who just can't sleep the recommended amount because they have to work and they have kids and they have other obligations.
Yeah.
If we target these slow waves, maybe you're not getting enough sleep, but we can make your sleep more efficient so we can kind of protect you against those health problems that would otherwise happen.
Absolutely. And I want to ask, and this might be a little bit out of the realm of what you're working on, but I don't know if you've kind of done some research into the connection between like the parasympathetic nervous system versus sympathetic nervous system and sleep. If not, that's totally fine.
A little bit.
We'd love to hear about kind of the connections that you've seen. What do those things mean? I guess.
Yeah. So the So it's quite complicated, actually. I think so the sympathetic nervous system is like usually what we call the fight or flight system. It's involved in kind of essentially has a stimulant effect on the body. The parasympathetic system is called the rest and digest system, and it is involved with kind of promoting all the things that happen when we're relaxing. And so the idea is that the classical idea is that the brain has these kind of two axes, and it kind of turns one on depending on what you're supposed to be doing. Sleep is an interesting state because it is mostly parasympathetic, but you do see some sympathetic activity too. And actually, I think it's in sleep. Actually, I think the traditional definitions of those systems break down a little bit. You see when people are deeply asleep, sometimes you'll see a bunch of sympathetic activity that is like related to memory processing. We think, or it's very complicated, and we think it is. The sympathetic system gets activated during some kind of active processing. Kind of when the brain is trying to learn stuff, even though you're asleep.
Yeah. So, so like you said, the sympathetic nervous system is kind of working on the memory processing, right? So let's say a person has sleep apnea and they're doing this memory processing. Maybe they're using kind of the research that you guys are working on and trying to play that audio, and then they wake up, right, due to lack of oxygen. Could that or would that put like maybe stress on that sympathetic nervous system, which is active, trying to restore these memories, and suddenly now you're awake and it has to be fully active because you're trying to like not die, sort of thing.
Yeah. I guess it's hard to. I guess it depends on what you mean by stress. I think I don't think it's like a case where the sympathetic nervous system has like a limited capacity and you're going to kind of stress it or burn it out by doing. I don't think that, like, generally speaking, that doesn't really happen because all these systems are self-limiting. I think what is mostly going to happen if you get woken up suddenly is that you interrupt all these processes that are going on, and that can do things like weakening the memory. It's like I said, it's kind of like unplugging a hard drive while you're writing data to it. I think the kind of, and what's really going on there is that kind of when the brain goes from this sleep state where memory replay is happening to when they're awake, we think that it's not just sympathetic and parasympathetic, but there's actually all sorts of neurotransmitters are different, and we think that having that sharp transition really disrupts whatever memory that the brain was replaying.
Okay.
It also, interestingly, it seems like that is also involved, like, so there's a lot of kind of nightmare disorders, things like sleep paralysis that we think involve an incomplete transition between the sleep and wake states.
Connect that to like breathing and airway. Like, is it common for Thai patients to have to be mouth breathers?
It is common, and I don't know that there's an actual number of it. But there certainly are studies that show that a short or a tight lingual frenum has increased incidence of mouth breathing. Because all of us, our neutral position is tongue up against the roof of the mouth, lips sealed. And so when your tongue can't get there, you develop this open mouth posture. Not everybody does. Some people, the floor of their mouth is very elastic and it lifts, and so they're able to, again, compensate into that pattern. But it's developing that open mouth posture. And then they develop this habit of breathing through the mouth, which obviously has airway repercussions as time goes on.
I think the overall consensus is that open mouth breathing is less good for sleep quality. It's associated with a higher risk of sleep disorders. I think, and it does seem like it is potentially associated with things like sleep apnea too. Just something about when you think of it, so it's very important when we're asleep. It's very important for the airway to stay open, and there's a lot of ways to mess that up. We normally don't think about it because when we're awake, we have a lot of muscles holding our airway open, and we're also very conscious of it. But when we're asleep, actually, the position that you're sleeping in, it's possible for a lot of things to happen that actually restrict the flow of air through your airway. And the thought is actually sometimes when people sleep in there with their mouth open, because of the position of the mouth and the tongue, it can be a less efficient way for air to get into their lungs, and they're breathing less efficiently. The caveat obviously is like, I mean, we generally breathe through our mouths when we're not getting enough oxygen through our nose. So sometimes the problem is not really the mouth breathing, it's probably like that they have nasal congestion or a problem with their septum, or potentially even some other type of apnea, and they're opening the mouth to breathe can be kind of a reflex to not having enough airflow too.
Yeah, so you mentioned slow waves, as a part of the kind of the deep sleep process. So what if we're not getting to deep sleep, for some reason?
Yeah, absolutely. So we actually see this a lot when people's sleep is disturbed, either because like they're not breathing properly or because there's a lot of environmental noise, and they actually will not go into slow wave sleep. So slow waves happen pretty much, we actually define deep sleep as it's when the slow waves happen.
Okay.
And what you'll see is that if people's sleep is very interrupted, they will often not go into that state. What you'll see is they'll go into kind of shallow state sleep. You have a very brief awakening, they go back into shallow sleep. And you will actually see after a night or so of doing this, the brain tries very, very hard to go into slow wave sleep. So it will try to go into slow wave sleep very fast. That's a compensation for being deprived of slow waves.
Yeah.
But if your sleep is very, very interrupted, it will absolutely keep you from having slow waves.
Yeah, so you mentioned slow waves, as a part of the kind of the deep sleep process. So what if we're not getting to deep sleep, for some reason?
Yeah, absolutely. So we actually see this a lot when people's sleep is disturbed, either because like they're not breathing properly or because there's a lot of environmental noise, and they actually will not go into slow wave sleep. So slow waves happen pretty much, we actually define deep sleep as it's when the slow waves happen.
Okay.
And what you'll see is that if people's sleep is very interrupted, they will often not go into that state. What you'll see is they'll go into kind of shallow state sleep. You have a very brief awakening, they go back into shallow sleep. And you will actually see after a night or so of doing this, the brain tries very, very hard to go into slow wave sleep. So it will try to go into slow wave sleep very fast. That's a compensation for being deprived of slow waves.
Yeah.
But if your sleep is very, very interrupted, it will absolutely keep you from having slow waves.
So I guess, let's say like theoretically, right, we were able to, because you mentioned like the brain naturally just won't go straight into slow waves.
Yeah.
It'll, have these little kind of waves. So, but like theoretically, if we were able to, this is very abstract, but if we were able to force the brain to go right into slow wave sleep and not, is there a benefit to shallower sleep? Like kind of a lighter sleep that we're missing out on, that we don't get, because if we just go to straight to slow wave sleep, then we kind of lose that.
That's a good question.
Yeah.
In a health sense, I think the answer is that we haven't found anything yet. I do think there's potentially some things there. And one thing that there's some evidence that light sleep in particular, that state right between kind of where you're kind of half asleep and half awake, is really useful for creativity. So actually people come up with really creative ideas in that state. And I think potentially you lose some of that. People might be less creative. They might kind of be less good at solving problems in their lives if they're always going straight into deep sleep. So in a healthy brain, it takes, like in a healthy brain with a great lifestyle, actually I would say like it takes about 7 to 10 minutes to fall asleep, and then you're in light sleep for maybe about 20 minutes, then deep sleep for maybe another 20 to 30 minutes, and then REM sleep where you dream for another 10 minutes or so. And so there's this nice kind of staircase shape that you see. That's kind of the textbook sleep cycle. No one's sleep actually looks like that, but it kind of, you go like wake, light, deep, and then a little bit up to REM.
Anything behavioral that you noticed in terms of like any of them get like happier?
No, just Molly. Molly, I definitely, because like I said, after 3 months,
That's big.
Miles definitely. So he's had a whole thing with like mouth breathing and he used to be extremely restless sleeper, like a lot, yeah. Like it was, and he, I think, through yeah, I don't know. I guess it's through all the work we've done, the myofunctional, the tongue release.
But like by the time I was like 8, I stopped doing.
Yeah, I think it wasn't an immediate change, but over time he definitely got more. Well, now he does not move around the bed nearly as much. He never was a kid who like woke up sleepy.
Mm-hmm.
He maybe woke up wired, and maybe that was a sign of being overtired.
Next 3 words are nervous system, fascia, and ties.
The nervous system controls and coordinates everything. So if you release ties you're not going to get proper tongue function unless the nervous system is functioning well.
Release a couple of years ago, and I also had chiropractor care before and after. It's so subtle, you can't really see it right away, but you can feel it. And for my younger kid, he bounced back so quickly. Like for him, it was nothing. The procedure, he recovered quickly. He's one strong guy.
That's great.
And I can see the difference. He started going to chiropractor care when he was 3 or 4 weeks old versus my older child, when he was 4 years old. And there was a huge difference of how strong and just like all of the milestones that he had to kind of meet, he was meeting them ahead of time, and just very joyful, playful, happy kid.
That's great.
And his nervous system is very regulated, and he's just happy to be around.
Yeah.
Yeah.
And when we're looking at the nervous system, we're connecting our suck, swallow, breathe, our breath, and the fascial system, right? It's all coordinated and controlled by the nervous system. If we were to just work on the fascia, or just work on massaging the jaw, or just doing exercises for oral function, and there was still pressure on the nervous system, those issues are not going to resolve. They're going to remain there as long as there's pressure on the nervous system.
When you can lift your tongue up to the roof of your mouth and have the back portion up, you actually stimulate your vagus nerve. And the vagus nerve is king of parasympathetic activity, because it has a direct connection to your gut, which is, as we all know, our second brain.
Can you talk a little more about that, the vagus nerve and parasympathetic nervous system, I suppose?
So the vagus nerve controls, it's the longest nerve, so long distance to travel. It controls a lot of parasympathetic activity in our body. So what that means is that it does things for you that you never have to think of, like peeing, pooping, reproducing, digesting. Those are all things like the vagus nerve do that you don't think of. But when we have a disease, it's those things that are A, out of our control, but B, it's a direct example of where your fight or flight activity was higher than your rest or digest activity. So resetting that nerve sends the right signals to those parts of our body. So even like our heart beating, it's not something you make yourself do. Chewing is something you make yourself do, but your heart beating isn't something you make yourself do. All of the valves involved in our digestion, we have 4 valves involved. We don't tell them what to do. But for example, in a disease like GERD, it's one of those valves that doesn't work properly. So when you can tame your vagus nerve, you can actually tame a lot of what's wrong with you.
So, in the sense that, then would you say that it connects in the sense to like the subconscious?
Absolutely, absolutely.
I don't think that a release surgery is that big of a deal. I've seen them. In fact, I was just observing yesterday in one of our primary providers' clinics. Saw quite a few of them happening yesterday. It's a very quick procedure. There's pros and cons. I won't go down that as far as, how traumatic it is, but it's very quick. And I don't think it's in the lifetime of the child it's going to be a big deal. But what really concerns me, and the reason that I work so hard to teach and to get this information out there, is that if that's the only thing that's done, and the body work or the chiropractic work and the removal of the neurobiomechanical interferences doesn't happen, then that's where, as we talked about, that baby is going to have neurological consequences later in life. They're going to have to adapt. They're going to go down that road when we can take care of it all in one fell swoop.
Absolutely. So the more you nasal breathe, and the more you have less respirations a minute, you are going to be a calmer person. So again, I'm going to say it again, the more that you breathe, slower respiration cycles per minute. The ideal is 6 to 12. So if you can do that, you're going to slow down your breathing, you're going to slow down the exchange of gases. Your whole body goes into a little bit of relaxation state. And that allows things like our pineal gland to get activated and offer a more relaxed parasympathetic viewpoint for the body to make decisions from.
And does that work if we're breathing consciously as well? Like if I consciously slow down my breathing, is that also going to...
Absolutely.
Okay.
In fact, one of the best ways to slowly and consciously slow down your breathing is a practice called yoga nidra. So you can do that while you're awake and in like a busy day, but take 10-15 minutes out of your busy day and actually practice yoga nidra. You're consciously slowing down your breath. And it's like you took an hour nap.
The brain goes from this sleep state where memory replay is happening to when they're awake. We think that it's not just sympathetic and parasympathetic, but there's actually all sorts of neurotransmitters are different. And we think that having that sharp transition really disrupts whatever memory that the brain was replaying.
Okay, so really important, when we have an infant, they can't tell us that if they're in pain. They can't talk to us and tell us what's going on. So it's all guesswork for parents and us. So we're dealing with, in the infant, as chiropractors, the autonomic nervous system and creating balance within that system. So the autonomic nervous system consists of two sides, the sympathetic side and the parasympathetic side. Okay, sympathetic is fight or flight. Parasympathetic, rest, relax, digest. When an infant has tethered oral ties, they're frustrated because what should happen normally, they should be able to latch onto that breast, they should be able to take in nourishment, and it should go without having to think. But when they can't do it, they're pulling on and off the breast and moving all around, and they're struggling, and they get frustrated, and mom gets frustrated. And then it's a huge struggle. Where do you think that lands the infant on that platform? Do you think they're in rest, relax, digest, or fight or flight?
Yeah.
Okay. So when they're in fight or flight, that creates the tension in the body and the struggle and more crying. So we may see colicky babies, we may see babies with constipation, reflux. All of those things can occur when the system is under stress. And the most important thing is to recreate that balance. It's called adaptation. That when an infant is born, they should be able to adapt to any environment that they're in and create that homeostasis that we're looking for, to know when their body is able to relax and know when an actual threat is coming at them. If there's any interference within that system, it is going to contribute and put that baby into more sympathetic dominance. After that release, the brain doesn't know that that tongue was released, right? Just like if you had lost a limb, you still have a phantom limb.
Yeah.
So the brain is still giving improper signal to the tongue. So as it's healing, we need to keep the pressure off the nervous system, and that fascia, we need to make sure that in the healing phase, which is about 6 weeks post, that we don't form any compensatory strains anywhere else in the infant's body. So we do craniosacral therapy, we do cranial work for the cranium itself to make sure that the cerebrospinal fluid's flowing properly and well, feeding the nervous system well as well. So there's really 3 components. It's the chiropractic adjustment, it's cranial work, and it's craniosacral therapy.
Could you talk a little bit more about craniosacral therapy and maybe other modalities that you also use to help along with chiropractic care when a child has a tethered tissue?
Yeah. So the craniosacral therapy is, like I said before, it is working directly with the fascia and the layers of the tissue to take the tensions out. So when we do the craniosacral therapy, I'll tell the parent that, your babe, don't be alarmed if your infant no longer rolls to their side, they're resting on their back, or that they're happy to be on their back, or they're happy in tummy time. The purpose of that is it releases all the tensions and balances the fascia throughout the body.
Underneath the muscles and underneath really everything is our nervous system. And way back, I can't tell you the year, but when chiropractic was founded as a profession by, what was it, B.J. Palmer and D.D. Palmer, that premise was that they were addressing the nervous system by means or through the structure that was supporting it. So I really adhere to that these days, that when your structure is off, then it causes an imbalance in the nervous system.
So in terms of the ties, how did you what was the first symptom? Like, what made you realize that there was something wrong?
So at 5 days old, my first daughter just projectile vomited all over me, and from that day forward it just continued happening.
Okay.
And I'm like, what the heck, this is not normal. Everyone's like, maybe spit up, it's normal. I'm like, no, this is not normal. So then I started, I spent a lot of time on Instagram, and I follow a lot of IBCLCs and lactation consultants and stuff, and I came across a post about lip blisters, and I'm like, well, that's exactly what my daughter has. She has these lip blisters, and I started diving into all the symptoms of tongue ties when you're nursing a baby, and she had a bunch of them. She never really had a deep latch. She didn't hold a pacifier. Trying to think what else. She was just unhappy, I felt just unsettled. So that's when I kind of went down this road of finding out more about tongue ties.
Okay. And then you had another child. As far as that process, so now you kind of have some understanding of ties and chiropractic. Yes. How was that easier? What did you do differently?
It was so much easier the second time around, because just like the first, every time I asked the providers, whether it be the pediatrician in the hospital or the nurses, lactation consultants, or their pediatrician once they were out of the hospital after giving birth, everyone was like, no, they don't have a tie. No, it looks good. And they look in their mouth and they don't see a tie, so it's all good. And so the first time around, that was really hard because I only trusted them to know. And so I was like, okay, they all say no, it just doesn't make sense. But the second time around, knowing what I knew, but nonetheless, I did see chiropractic care beforehand, but didn't understand the importance of it really. So I got the release, and then after that is when more of the body work came into play. I just kind of proceeded on my own.
Can you talk a little more about that, the vagus nerve and parasympathetic nervous system, I suppose?
So the vagus nerve controls, it's the longest nerve, so long distance to travel. It controls a lot of parasympathetic activity in our body. So what that means is that it does things for you that you never have to think of, like peeing, pooping, reproducing, digesting. Those are all things like the vagus nerve do that you don't think of. But when we have a disease, it's those things that are A, out of our control, but B, it's a direct example of where your fight of fight flight activity was higher than your rest or digest activity. So resetting that nerve sends the right signals to those parts of our body. So even like our heart beating, it's not something you make yourself do. Chewing is something you make yourself do, but your heart beating isn't something you make yourself do. All of the valves involved in our digestion, we have 4 valves involved. We don't tell them what to do. But for example, in a disease like GERD, it's one of those valves that doesn't work properly. So when you can tame your vagus nerve, you can actually tame a lot of what's wrong with you.
I don't think that a release surgery is that big of a deal. I've seen them. In fact, I was just observing yesterday in one of our primary providers' clinics. Saw quite a few of them happening yesterday. It's a very quick procedure. There's pros and cons. I won't go down that as far as, how traumatic it is, but it's very quick. And I don't think it's in the lifetime of the child it's going to be a big deal. But what really concerns me, and the reason that I work so hard to teach and to get this information out there, is that if that's the only thing that's done, and the body work or the chiropractic work and the removal of the neurobiomechanical interferences doesn't happen, then that's where, as we talked about, that baby is going to have neurological consequences later in life. They're going to have to adapt. They're going to go down that road when we can take care of it all in one fell swoop.
Absolutely. So the more you nasal breathe, and the more you have less respirations a minute, you are going to be a calmer person. So again, I'm going to say it again, the more that you breathe, slower respiration cycles per minute. The ideal is 6 to 12. So if you can do that, you're going to slow down your breathing, you're going to slow down the exchange of gases. Your whole body goes into a little bit of relaxation state. And that allows things like our pineal gland to get activated and offer a more relaxed parasympathetic viewpoint for the body to make decisions from.
And does that work if we're breathing consciously as well? Like if I consciously slow down my breathing, is that also going to...
Absolutely.
Okay.
In fact, one of the best ways to slowly and consciously slow down your breathing is a practice called yoga nidra. So you can do that while you're awake and in like a busy day, but take 10-15 minutes out of your busy day and actually practice yoga nidra. You're consciously slowing down your breath. And it's like you took an hour nap.
At birth, no matter how the birthing process occurred, there's usually pressure on the nervous system. There's actually studies on that show about 99% of infants born have some form of nerve interference in the upper part of their neck, in the base of the skull.
A normal birth has been measured to have anywhere from, if I remember the statistics, like 25 all the way up to about 70 pounds of pressure on that little infant cranium and spine. Okay. So just out of curiosity, I looked that up to see how that compares to a whiplash car accident. And it's pretty much the same thing. It's pretty much the same forces. And imagine this is a newborn, the spine and the cranium is not fused. It's mostly cartilage. We've probably all either seen in person or pictures of little heads that are very distorted when they come out of the birth canal. Those elongated, like cone head type, presentations. There's a lot of forces there. So if those are not corrected, and again, of course, it ranges from different degrees. Parents ask me, well, what happens if it doesn't get corrected? And the answer is, in most cases, it's very rare to see an infant pass away. I mean, that would be horrible, obviously, and that doesn't usually happen. But what does happen is if that interference, that extra unhealthy pressure on that brand new little nervous system is not corrected, then what the baby has to do is adapt to it. And that's what happens, is it goes into a phase of adaptation, which then, you know, without going into a big old long class on all the developmental milestones and all the things over time that develop, how the brain develops, how the balance, all of those things develop, the baby has to compensate and learn new ways of doing that.
And certainly when we're talking about kind of strengthening the nervous system and that adaptability, what a cool thought that is, to have a more adaptable nervous system as we go into the birth process. So that tension that you can visually see, I mean, just start looking at babies, you know, when a stroller goes by, you know, take a look. Is that baby kind of asleep, hanging to one side? When, you know, that baby's picked up, are they kind of tilted or torqued? Does it look like there's tension, you know, in their spine, in their structure? Very often there is. And we see that in the office. Just imagine. I mean, we've all had kind of like, oh, I slept wrong and I woke up and I have this stiff neck kind of thing. Oh, it'll go away in a couple of days. What if the baby has something like that going on and they can't communicate that? And they're held in positions, or they're put in a car seat, and that tension is reinforced. And they're like, oh, I guess this is just reality. You know what I mean? And it's almost like you can tell when you find those tension areas and you start to kind of work with these babies very gently, that they unwind some of this tension. You know, I mean, we're taking into account the development of the spine. You know, are those growth plates closed? You know, what the joint structure looks like at various times in development. And you're offering I think, an ability for kids to let go of some of the stress that they've picked up along the way, whether that's through the birth process or whether it's when they're learning to walk and they're falling down hundreds of times. You know, these types of things, I think, can start to, if we're not careful, accumulate. And in a sense, being proactive like this and taking care of kids in that wellness mindset, in that proactive kind of salutogenic mindset, I like to call it. It's really it's a different approach, and in that sense, yeah, I think every kid can benefit through having their nervous system checked.
There's a lot of work out there on the parasympathetic vagus nerve stimulation, so really rewiring our nervous system and being in a more parasympathetic state, which is a more rest and relaxed state, versus a sympathetic fight or flight state, is really the answer for all of us to stay disease-free, because we don't give our bodies enough credit to do the healing. If we create the environment, again, if we create the epigenetic environment in our body to express those healthy genes, we can help ourselves.
The body work or the chiropractic work and the removal of the neural biomechanical interferences doesn't happen, then that's where, as we talked about, that baby is going to have neurological consequences later in life. They're going to have to adapt. They're going to go down that road. That, you know, the huge range of, you know, autism, ADHD, ADD, all of those things, oftentimes, and if I can be so bold as to say almost always in some degree, stem from that interference.
Okay. So as you were right now mentioning that the dural system is very important, could you just talk a little bit more about that for the people who may not know what the dura mater is, or like what the dural system is? So we could just start with, if you could explain what that is.
The dural system is the lining, basically the lining of the nervous system. So a lot of people have heard the term meningitis. Okay, it's a big scary term. The meninges is kind of another word for the dura, and it's a thick, kind of leathery type covering of the entire spinal cord. And inside of it is fluid, the cerebral spinal fluid. And that dura attaches at the upper neck. It doesn't stop there, though. I think a lot of people think that it stops there. It actually becomes the inner lining of the cranium, okay, which is important again when it comes to those distortion patterns that the baby has and how it affects this whole system. So it's attached, it becomes the inner lining of the cranium, and it also it is anchored onto what's called the sacrum in the pelvis. Okay, so that fluid flows up and down under normal circumstances without any restriction or interference in this system. It is pumped up and down the spinal canal by the movement of the cranium of the sacrum. Okay, those structures move ever so slightly, and it allows this kind of nice normal rhythm of this fluid. And that fluid does a lot of things in the body, like pressure control and nerve conduction, and it has a lot of like protective properties of like heat control, and I think there's some antibiotic type. It protects, you know, the nerves from infection. It's important stuff. So basically, if that system is not moving properly, then the pressure builds up, and that can become detrimental. It can cause a lot of problems. Babies that are colicky and very like high, what we would call sympathetic state, where they're just very tense and can't be calmed. A lot of the, again, neurodiversities, meaning like ADD, ADHD, where they're just in this hypersympathetic state and they're overstimulated all the time. That has a lot to do with that dural pressure. So, you know, once again, that is something that we assess for and is affected by the alignment of all of these structures that we're talking about.
So is it common in infants to have dural tension from birth, or is it
Very,
very common? Yeah.
very. Yeah, again, because of the pressures in the birth process. Very,
Mhm.
very common. Yeah.
Oh, yeah.
If you see a baby arching its back, that's a big sign. Just very
Mhm.
tight, tense, colicky, reflux, you know, arching its back. You know, there's a lot of different signs, but it's very common for babies to have this issue, especially those of a C-section, because they were not squeezed through the birth canal properly to get that normal rhythm going.
Right.
The next three words are ties, nursing, and breathing.
So infants who have ties have difficulty with the suck, swallow, breathe mechanism. And that, because they can't suck, swallow, and breathe and coordinate that, they have difficulties with nursing or feeding from a bottle for that matter. So they're going to, with that difficulty, they're going to become frustrated. They're going to be pulling off and on the breast. They're going to be screaming. It's going to create upset with the parent who's feeding them as well. And so then all that stress creates and puts the baby into sympathetic dysfunction, or what I call sympathetic overdrive. Once they're in that sympathetic overdrive and they're distressed, their nervous system is so stressed that it just like causes the problem to get worse and worse and worse. So until those issues are addressed and until we relieve the cause of what's causing the issues with suck, swallow, breathe, which is partially by doing the tongue tie release, we're not going to see good function with the infant. It's also going to affect them with their neurodevelopment in the future as well, if it's uncorrected, because when they're in stress and they're under so much stress and they can't coordinate suck, swallow, and breathe, it's going to affect them, their ability to potentially meet their milestones through the first year of life.
As you mentioned, there's like a lot of factors that affect a child and during their birth and that affect their development. So could you just talk about like a few specific, like the big factors, like maybe having like a C-section or having like a vaginal birth, and how would that affect development for infants? Like how does it differ?
The muscles and the nerves are all supported by the structure. Well, the same thing is true with the womb and with the baby. And so, you know, all of basically the space that the baby has to live. As I explain it easily to my parents, that the pelvis is made up of bones, which also obviously have strong ligaments that hold it together and strong muscles attached to it. And in pregnancy, there's a lot of extra hormones, one of which is called relaxin, and all of those things soften and is very pliable, which is really convenient if you're trying, as I tell my patients, trying to spit a bowling ball out of a very small hole, so you have to have everything able to open up. But those structures also can become fairly unstable and move during the pregnancy, and those things literally change the shape of the pelvic bowl. So the baby has limited room to move. So that can affect their development, but it absolutely affects the just the opening and the ability of the body to relax and to be able to have a gentle birth.
He would be hungry enough that he would then go back to feed, but it wasn't at the levels that it probably should have been.
Well, what do you think happens if the baby has a traumatic birth, gets stuck, in a certain position, again, with those forces, has those distortion patterns in their cranium? What do you think happens to those muscles at those attachment sites? They get pulled and they get compromised.
Yeah, so talking a little bit more about that tension, especially in the mouth, like could you talk about how that affects like the facial muscles and how it affects like the TMJ maybe, like the development?
So when there is that tension there, and so much compensation is happening, especially in these younger kids, you can feel that these muscles are really having to work. Particularly, let's talk about a nursing infant. The tongue is supposed to come up, support mom's breast tissue, then the middle of the tongue raises and lowers to create a vacuum, and it's that vacuum that extracts milk from mom's breast. And so for these kiddos who have that tethered tongue, that range of motion's not there. And so they fatigue, they're sliding off of mom, it's really hard work. So what these kiddos can do is they start to up, down, chomp on mom. So that's recruiting so much of the musculature of the face. And so you can sometimes feel even 2-3 week old infants who have just these incredibly overdeveloped muscular systems in their face. And if you think that is in a lifetime, is that they're just not using these muscles the way that they were meant to be. They're kind of always on. And as you look at the trajectory of that through childhood into adulthood, these muscles are really overworked. And we can certainly get pain in the temporal mandibular joint. Things can, if there's one side tighter than the other, it can throw the entire alignment of the TMJ off.
But it was so traumatic. Like the experience was so traumatic. And like I never used to sleep. I never did anything. I just focused on that only. So I just didn't want to be reminded of it.
That's fair.
Just didn't want to be reminded.
I'm sorry for reminding you.
Yeah. No, it's a long time now,
No, of course.
But at that time, I just didn't want to be reminded of it.
I understand. I wouldn't either.
That initially it was very tough because you wait for your milk to come through, and I was convinced that I only wanted to nurse my child. I did not want a bottle. And the hospital we were at was an exclusively breastfed hospital, so they were forcing us to breastfeed. And he was upset because he wasn't getting any milk, and they were not giving the bottle, so it kind of was a traumatic experience. Finally, my milk came through, but he wouldn't suck. He would be on me, and he just would cry all the time, cry, and he just wouldn't drink milk. And I tried everything. I tried pumping, I tried putting in a bottle, nothing worked. Anyway, for the next 6 months, I went to the doctor every single day. Every single time I went to the doctor, I would sit in my car and just cry my eyes out because the doctor would tell me the same thing. Your baby's too small. He's not even on the growth chart. He's not thriving. We might have to do some intervention.
Yeah.
I took him to my pediatrician, the same pediatrician. And I told her, I said, listen, my mother-in-law is telling me that he has a tongue tie. Can you check? And she said, no, he doesn't have a tongue tie. We do this check, at the baby when he's born, at 3 months, at 6 months. We check, especially if the baby's not thriving. I'm like, I have never heard you say that you did a tongue tie check. And she said, well, we don't say it, we just do it. I was like, okay, check to see if he has a tongue tie. And she checked, and sure enough, it was a tongue tie. And she said, yeah, he does. I'm like, do you have anything to say? My life has been torture for the past, it was exactly 14 months later that 14 months later that she diagnosed it.
So you see this global picture where you're like, no, there's tension in the whole region. What did that birth look like? Was that a cesarean delivery? Was that an assisted vaginal delivery where there was pulling and tension? Does that baby actually need to be supported to unravel some of that tension rather than to have potentially healthy tissue cut?
Food, it's just when you use your tongue properly, you kind of signal your body to start making enzymes which help the food get digested in your stomach. And when you don't have that tongue movement and flexibility, it just kind of inhibits the enzyme production and inhibits the digestion, which kind of makes your digestion worse and doesn't help with that. So that's one other component to the tongue tie.
Impacts feeding way more than people give it credit for, and pregnancy as well.
Yeah.
Like when I have somebody who's having difficulty nursing, like my whole beginning of my intake is, what was your pregnancy like? What was your labor and delivery like? If we are pushing for a long time, I always say it's like a turtleneck. If we're nice and lined up, the turtleneck goes right on. It's all nice and smooth and everything's fine, everything moves. If we're trying to put a turtleneck on backwards, we're trying to come out the back of our head with 87 pounds of pressure in every contraction, it's gonna mess stuff up. And then we're expected to be functional. If you woke up with your head stuck like this, could I drink coffee like this? Sure, I'd figure it out. But 12 times a day, probably not. So the babies that have the most significant difficulty in my practice are ones that were pushed for a really long time or a really short time. Really, really, really fast. And babies that are wedged in the pelvis for a really long time in very funky positions. They'll be like this when they come out. They won't be able to straighten up and breathe. So birth is huge.
To historically, birth would have been something that you would have seen multiple times, perhaps in your own home, your mother delivering your siblings, right? And then maybe as you become a little bit older, maybe you would attend a friend's birth or, someone else in the tribe. You would have been exposed to birth. You would have seen how birth goes in a natural sense. And all of that is kind of obscured now. It's behind this veil. It takes place in a hospital. We don't really see it. You can only have one visitor during the birth process, this kind of thing. Maybe we've seen representation of birth in movies, right? And we have this idea of what it's like, oh, push harder, push, this kind of thing. But we've never really been exposed to birth in a natural kind of human way that we've always delivered. So this is another difference. When we recoil, that applies to the pelvic floor. That applies to the cervix as well. And I think that can help to kind of prolong the time in which it takes for the cervix to dilate. And then certainly just the awareness of certain positions and how those postures and positions can facilitate the baby, kind of spiraling through the birth canal. That's the other thing that I think most women haven't been subjected to, is the baby doesn't just get pushed straight out. They kind of almost corkscrew out. They get kind of rotated. They rotate out. And that's really a testament to the design, the brilliance of the body, and how the uterine fibers are spiraled in nature. So if you picture like a hot air balloon, the colorful hot air balloon that has the spiraled, sections, colors to it, that's the uterus. And when the uterus contracts, it contracts with a twist.
It's a stressful event to be born anyway. I always think about this on like a really basic level. I was in a room and it was warm and cozy and I had no clothes on and I was swimming in warm water, and then all of a sudden it was bright and there was temperature regulation, people were loud, like this is making me on fight or flight and I'm an adult. I'm like, that sounds horrible. Yeah. Like it's that sounds horrendous. It's really, really, it's stressful for them. And
we as humans, we learn to compensate for things, and some compensations can be good and some compensations can be bad. So my goal was to breastfeed my first daughter, and we were experiencing a ton of trouble. I was in the most pain I've ever experienced in my life. And I was explaining that to providers, and they kind of didn't really take me seriously, or even think about the fact that I had just given birth, so that claiming that I'm in that much pain should be something to take pretty seriously. My daughter was very, very cranky, very angry baby. Even with bottle feeding, we really struggled. That took us a while to get her to bottle feed effectively. So, I saw an IBCLC. I was in frequent contact with my pediatrician and was written off. So I ended up doing my own research. I found a pediatric dentist who did diagnose my daughter with ties. We went through a release and definitely had improvements, but it wasn't perfect. And we still struggled for a little bit. And then my second daughter, I had already had this practice, so I was definitely way more knew so much more second time around. And that made a huge difference. I've had a completely different experience. She also had oral ties. We did the release, and we did all the right work before and after, and it just made a huge difference.
There's basically 3 things that a baby has to do in order to feed properly. They have to be able to open their jaw properly. Okay, to latch. They have to get a wide latch over like the breast tissue. Okay, so that's the jaw. Okay, so the jaw has to be in alignment, and the jaw is just the union of the mandible and the temporal bones. Okay, then they have to be able to use their tongue properly. So we talked about the tongue, to basically squeeze that breast tissue up against the palate, the roof of the mouth, to get a seal. Okay, so if the tongue is being anchored either by a genetic tie or by, again, origin and insertion points, that's not going to work right. And then the palate is the alignment of a couple of cranial bones, so that one's important too. I assess the palate. The upper cervical spine is very important for many reasons, but when you're just talking about breastfeeding, the baby has to be able to turn its head in order to feed from both sides. Very common that the parent will tell me the baby really struggles on the left side or really struggles on the right side only. That's because they're having a hard time turning their neck. So those are the basic ones. There's more to it than that, but those are the basic ones.
Do many of your patients have like oral ties?
I definitely do see a lot of oral ties. I will say that I look more at like the oral dysfunction piece before really concerning myself with, is there a tie or not? I really try to focus on function. So, I'll look at what a baby's oral function looks like. And if I do see a restriction in mobility, just determining if there are other factors that could be contributing to that, and whether or not we are going to consider it an oral tie, or just we need to work on the mobility, strength, endurance piece.
What are like different aspects of feeding that you focus on? Like, could you talk a little bit about like how oral motor skills are important for feeding, and then like other aspects like maybe sensory processing, like how that affects feeding?
Yeah. So feeding is really, I think, more complex than people think or understand. Every time that I do an evaluation, I take a full body approach. So especially when we're talking about infants, we really need to look at their full body,
their posture, their strength, their toleration of mobility, different sensory inputs. So yes, I do a lot of work in the mouth, and I'm assessing a lot about what's going on in the mouth, but it's really a full, especially for infants, it's a full body experience. So what is happening on that full body level is really important. There's a lot of sensory systems. They all work together and can kind of even influence and intertwine. For the big ones that I look for with infants, I look at the vestibular system, which is their processing ability to process movement. I'll look at tactile system, which is how their outside skin is responding to certain inputs. I also look at intraoral sensory processing, which can be related to that tactile system and how that, and then what did I say? And then the interoception too. We want to make sure if a baby's uncomfortable or constipated, that's a really big one that we don't always think about, that can affect how they're going to feed, especially if things are not moving well. So that's another one that we really want to think about and look for. I think those are the big ones. But in general, yeah, sensory system, and it totally impacts if our babies are well regulated and getting the sensory input they need and processing those sensory inputs appropriately. That's going to impact how regulated they are, how comfortable they are, and support their feeding skills. It's really common for us to see a baby who has tethered oral tissues and their intraoral sensory processing is off. And that's usually for a few reasons. Ideally, we want the tongue to be resting up in the palate and get some nice contact with the palate. That is our ideal oral motor resting posture. We want to be breathing through our nose. If the tongue is tethered down and can't get that elevation, then the palate is also not getting that stimulation. That's going to impact that sucking reflex, a baby's ability to suck consistently. And then also that gag reflex is going to be overactive because that palate is not getting the typical inputs that we would expect it to, specifically with tongue movement. So now when we go to suck or we go to put something in their mouth, we might get an abnormal response, like a gag response. And that's going to impact how we're accepting the breast, the bottle, a pacifier, anything like that. So it's actually really closely linked and tied for sure.
The uterus is like a big water balloon, and it's a muscle like any other muscle, or it's a special muscle, but it's a muscle.
Yeah.
And it is anchored into the pelvis by thick ligaments that are attached at various positions in the pelvis, and the sacrum and the iliac bones, and into the perineum area. And again, if that structure where they're attached is misaligned or imbalanced, it's going to pull on that muscle in or abnormal ways, unhealthy ways. Mm-hmm. And then that affects the baby's positioning. I always do like the baby literally doesn't have enough room to move the way that they're supposed to into that optimal birth position. Mm-hmm. Because it's basically when that happens, it's like pulling on two ends of a water balloon. There's just the diameter, the room that the baby has is limited. Mm-hmm. So that's where we get into abnormal birth positions. And again, if the baby is trying to come out and it gets literally, we hear the term that the baby is stuck. Well, it's literally stuck on the structures of the pelvis.
And could you talk about the different types of birth and how they affected, a C-section or just a natural?
Yeah. It would depend on kind of where the baby was in utero, so that's part of it. Yeah. A nice smooth vaginal delivery can be great, but if a baby is stuck in flexion with its head like this and its feet up in its face for 11 weeks. Even if it came out nice and smoothly, like unwinding that baby is going to be hard.
Yeah.
Right. So I find subsequent babies, when there's more room, they tend to do a little bit better. C-sections can be really, really rough. I see a lot of like upper cervical impact on C-section babies.
Yeah.
Really, really frequently. Even if people don't tell me about their birth and what they did, I'm like, you can pretty much figure it out. Long pushing phases can be hard. Posterior babies with the back of the head are some of the worst feeders when they first come out. They have a big fat cone head. Everything is being compressed when they're coming out, and you can't open your jaw very wide if everything here is compressed. So nice, smooth, easy labors are great. We don't get them as often as we
You
should.
can feel that these muscles are really having to work. Particularly, let's talk about a nursing infant. The tongue is supposed to come up, support mom's breast tissue. In the middle, the tongue raises and lowers to create a vacuum, and it's that vacuum that extracts milk from mom's breast. And so for these kiddos who have that tethered tongue, that range of motion's not there. And so they fatigue, they're sliding off of mom, it's really hard work. So what these kiddos can do is they start to up, down, chomp on mom. So that's recruiting so much of the musculature of the face. And so you can sometimes feel even 2-3 week old infants who have just these incredibly overdeveloped muscular systems in their face. And if you think that is in a lifetime, is that they're just not using these muscles the way that they were meant to be. They're kind of always on. And as you look at the trajectory of that through childhood into adulthood, these muscles are really overworked. And we can certainly get pain in the temporomandibular joint. Things can, if there's one side that's tighter than the other, it can throw the entire alignment of the TMJ off. And just make life just kind of difficult and uncomfortable.
And I think that's very, very common, unfortunately nowadays, that babies are favoring, looking one way or the other. And then certainly if mom is holding baby in the same, always on this arm, or for bottle feeding, always with the same hand, versus breastfeeding where we're switching sides. And I know breastfeeding isn't always possible, but if we are bottle feeding, are we giving mom that recommendation? Make sure you switch sides, because then the baby gets the variety of being held over here, rotating to the bottle, held over here. Are they getting that variety?
A feeding issue is a very time-sensitive issue, for a lot of reasons, on the side of the parent, on the side of the baby. We need to get this nipped in the bud and taken care of.
Yeah, birth is way more important than people give it credit for. It's really important. Yeah.
Here in patient 1, you can see the physical difference between the airway widths from this before image and this after image. This number, 29.18, should be higher. You can also notice this angle is 89.9 degrees. In this after photo, the first length changes to 34.83 millimeters. This length changes from 83.58 millimeters to 88.24 millimeters. In this next image, notice that the volume increased from 13.2 to 16.8 and the minimum area increased from 137 to 159. In this third image, the transverse width went from 34.97 to 38. The number should usually be around 40. Since it is too small, the tongue doesn't have enough space to seal properly. This shows that the procedure made a huge difference in the space for the tongue and was able to reduce the crowding in the front teeth. These are some more scans of patients with varying ages. These first photos are patient 2's scans. Here are their airway ones. Notice the tongue and its resting position. These photos are patient 3's scans. In the after photo, there is a larger angle here in red, and this length has significantly increased. These are patient 3's airway before and after photos. In these photos of the arch measurements, notice how the after photo has greater measurements, indicating more space for the tongue. This last photo is patient 4's airway. The red markings represent it.
The first three is breath, tongue, and palate.
All right, so when we're looking at the coordination of suck, swallow, and breathe, it's affected by where the tongue's resting in the mouth. So in resting stature of the tongue, it should be lifting and resting on the roof of the mouth, whether you're at sleep or at rest or awake. And if it's not doing that, then there's going to be difficulties, or it's going to disrupt the ability to suck, swallow, and breathe. So we have it with tongue ties, we often see a palate that is high. And what that looks like in an infant, if the palate is high, it's going to create a space, and they're not going to be able to rest their tongue onto the roof of the mouth. So not only once the tongue tie is released, we need to address the palate as well. Sometimes we can do that with cranial work, and other times we need to make sure, or maybe it'll be addressed later on with palate expansion and orthodontics.
So this is what the tongue would look like if we could see it, like the
Yeah.
full. Wow, that's kind of crazy.
Yeah, it's kind of crazy.
I was saying that one of the things that I did is I saw an ENT just to check my kind of sinuses and see if there's anything that is blocking my airway from that standpoint. And yes, I had deviated septum that most likely was caused when I was a child from an accident. I don't remember, but it was deviated septum that was blocking one of my nose airways completely. So in February, I had a surgery to fix that. And oh my goodness, I never thought I could breathe that well.
I was gonna ask, okay, I was just gonna ask you, what did you notice in terms of sleep or anything else after your release? You might remember a little bit more.
I do feel like I slept a little better. I have noticed a difference in mouth breathing though.
Yeah.
It better?
Yeah.
Yeah.
I used to be like.
But that's palate too. So I mean, that's expanding his palate, I think, really. Although he was in like a device at night that was meant to help his tongue posture, to help his tongue go to the roof of his mouth, which they say is like the natural expander. You know, if your tongue's on the roof of their mouth, it's expanding. But I do think this rapid expansion is pretty powerful.
I remember only being able to have my whole tongue on the top of my roof
Oh, really?
of my mouth instead of like
Oh.
the top of my tongue.
So your
And then
tongue, you felt the
after-
difference. Okay.
Yeah.
After I did the like just top of my
Yeah.
tongue, and I'm like, oh wow, nice.
Okay, so he's better at the.
Kind of on the topic of symptoms, then, in terms of like breathing, you know, how do these things affect breathing? How does a tie and
Yeah.
sleep, you know?
That's a great question. So first of all, tongue ties can cause open mouth posture. And when the mouth is open, the air comes out of the mouth rather than the nose. The second thing is that the ties cause the diaphragm and the shoulders to come forward and to be constrained. And so it causes shallow breathing. And the shallow breathing also predisposes to mouth breathing as well. And so it's the combination of the tongue posture and the fascia tightness that contributes to dysfunctional breathing.
Could you explain to us why is mouth breathing bad? Like, what is that? You know, because when I run, you know, if I go for a run, I'll breathe through my
Oh,
mouth.
for
So,
sure.
you know?
So you'll see that like athletes, Olympic athletes, sprinters, things like that, those who are winning are breathing through their nose. Mouth breathing is a compensation, right?
Yeah.
It's a adaptation for inadequate nasal breathing. And there's only so much you could do because when you're mouth breathing, you're losing a lot of humidity out to the environment. So if you're going to be running a marathon and you're mouth breathing, well, you're losing a lot of fluids. That's number one. If you're mouth breathing during sleep, you're also going to have dehydration and problems to that regard. Number two is that the air that you're breathing is cold, not your body temperature. And if it's cold, it affects the ciliary function. So you have cilia all throughout your lungs. that if you're constantly giving them cold air rather than warm air, warm humidified air, they have dysfunction. You can get problems like asthma, cough, the mucus lingers in. Also, the air that you breathe in goes straight to the lungs, and the lungs can get inflamed rather than fighting any microbes in the nose. So a lot of good health benefits, less inflammation to nasal breathing.
So breathing is a function of the autonomic nervous system. We don't have to think about breathing. It happens naturally. We're not sitting here going, breathe in, breathe out, breathe in, breathe out, right? That's an autonomic or automatic function of the body. And when we're looking at the nervous system, we're connecting our suck, swallow, breathe, our breath, I call the Thai sometimes the tip of the iceberg. It could be all that's going on, but many times and often we'll see babies with lots of tension, their shoulders up to their ears, or the parent will report, oh, my baby's like advanced, they can already, a newborn, roll to their side. They already can lift their head in tummy time, or when they're on the parent's shoulder, they have good head control. That actually is a sign of tension. Not talent.
They're doing more work than they need to because they're overworking in place of whatever dysfunctional muscle your body's trying to work around with this twist. So because of that, it's expending more oxygen than it usually would, which is depleting the oxygen stores even more that your body's building up throughout the day, which could lead to, non-restful sleep or not going that deep.
So just want to start off by talking about the importance of good nasal breathing, okay? So we want to be breathing through our nose rather than our mouth for a number of reasons. The first is that the nose works like an air conditioner, and it filters all the microbes and all the germs, and it also humidifies the air so it's the right temperature to come inside the mouth and to come inside the lungs. If you're not breathing through the nose and if you're mouth breathing, that's going to cause a domino series of effects. Number one, you're going to be more prone to colds and illnesses. But number two, it's going to affect your tongue posture.
In terms of like a process, as a parent, like let's say, I have a parent, I got a kid, just a newborn kid, let's say. Where should I go? How do I get this, diagnosed? What should the process
Oh, for sure.
like?
Yeah. I would say the first place would not be an ENT or a dentist. The first place you want to go to would be like a lactation consultant or a doula of some kind. Because if you want the right thing for your child, right, the best thing you can do is educate yourself, not only in terms of how to put the diapers on or make your home environment baby safe, but how do you feed your child? How do you cradle a child? What kind of physical body work can you offer? And so getting into the right mommy and me group or, prenatal classes for individuals who are open-minded to like a functional approach, that would be key. And then as you learn about the importance of diet, nutrition throughout pregnancy, avoiding, too much regular folic acid, making sure to take methylated folic acid, making sure that you can breathe in utero. If a parent themselves is struggling to breathe, they can be at increased risk of smaller birth, premature birth, and other issues for the baby. And then, of course, when the baby's born, to make sure that they're evaluated thoroughly for tongue and lip ties, but also torticollis and posture issues as well.
In terms of looking at ties and breathing as more of a almost not even like an urgent thing. Is that fair to say? Or would you
I would say that the focus has to not be so much just on, do you have a tongue tie or not have a tongue tie, which is important, but rather on, nasal breathing, tongue posture, chewing, swallowing, and body posture.
Okay, so you talked a little about mouth breathing. Can you just explain to me, like, why is that not ideal?
Yeah, so, it's not ideal because it's almost a wasted way of using oxygen as you're taking it in. It's better to have the option to nasal breathe because our nose is meant to breathe and our mouth is not meant to breathe. The reason being, when you nasal breathe, you have the ability to humidify, warm, and filter the air that comes through. So you can actually screen out things like bacteria, fungus, viruses, warm and humidified air, so that when it passes through the lungs, it's a better exchange of gases. And not only that, there's something called nitric oxide that gets made in this process. And nitric oxide is basically something that helps to promote blood oxygenation, increase blood flow, decrease fatigue, increase muscle repair, increase anti-inflammatory properties in the body. So it's a very important molecule, so important that it actually won a Nobel Prize in the 1990s. And I don't think it's gotten the kind of importance it needs to get to understand that actually our bodies can heal themselves. So when you mouth breathe, you don't have the capacity to do all of that. But also, especially at night, if you mouth breathe, you can draw in the air that can kind of go down to your stomach and pull up acid, for example. So causing things like acid reflux or GERD or stuff like that. So importance of nasal breathing also is that your tongue gets to sit up on the roof of the mouth. That initiates a proper swallow. And when it initiates a proper swallow, actually activates muscles like something called the tensor villi palatini, which is right here. And in little kids, that's actually what prevents ear infections when it gets activated. So yes, the answer is you can prevent ear infections in your kids if your child can swallow properly. If your child has an untethered tongue, if your child can nasal breathe, you can prevent so many illnesses and diseases.
Symptoms and stuff. My understanding of it, though, is so one of the big things. So it's cartilage, right? You know, of your nose. So one of the big things that will help with that is the facial musculature, in terms of how it pulls and attaches to the nose and keeps the cartilage straight. And facial musculature is tied into fascially, the neck musculature. And
Dr. Yagi agrees with you.
Yeah, erector spinae. There you go. Perfect. Yeah, I knew I liked that guy. Yeah. So not to say that this will happen, but theoretically, if we get your neck musculature rebalanced from getting everything else, in work in order, should start to change the angle of pull of your facial musculature, which could then help position the nose properly.
Those elementary age into middle school, high school, that sometimes stutters are coming from a tethered, from a tongue tie, because the sound that they know they're going to struggle with, they're almost like flipping through options, and so that's the stutter, is that they're really hung up on the sound. So those are the things that we see kind of developmentally, and so those are the things that, if they can work with someone like a speech language pathologist or lactation consultant and find workarounds at work, and they don't have to have a release, fantastic. But when a tongue tie is too restrictive and it's their those compensation patterns and they're still falling out of the realm of what is normal or socially acceptable, that's when it's considered bad.
Yeah. How would you connect that to like breathing and airway? Like, is it common for Thai patients to have to be mouth breathers?
It is common, and I don't know that there's an actual number of it. But there certainly are studies that show that a short or a tight lingual frenum has increased incidence of mouth breathing. Because all of us, our neutral position is tongue up against the roof of the mouth, lips sealed. And so when your tongue can't get there, you develop this open mouth posture. Not everybody does. Some people, the floor of their mouth is very elastic and it lifts, and so they're able to, again, compensate into that pattern. But it's developing that open mouth posture. And then they develop this habit of breathing through the mouth, which obviously has airway repercussions as time goes on.
And how does that, why is that a problem if you don't have, if you have a narrow and high palate?
Right, so obviously we need space for teeth to come in. And two, the roof of your mouth is the floor of your nose. And so a lot of this does circle back to airway. So if the roof of your mouth is narrow, your nasal passages are narrow, which is going to make it more restrictive for you to breathe through your nose, which is going to reinforce that open mouth breathing posture.
Recognizing that open mouth breathing posture that we're even noticing earlier on, and that correction of tongue posture.
And my biggest concern is if the infant is a mouth breather. Because if they're a mouth breather, they're not getting quality sleep because they should be breathing through the nose. And we know that later on, they're gonna, maybe it's an airway issue, they're gonna need to meet with other providers, like Dr. Zaghi, for example, in the future. If they're not breathing correctly and they're sleeping with their mouth open and that continues, when they get to school age, it's not going to be noted before then until higher learning comes in and there's more demand on that child's brain. They are likely to be diagnosed with attention deficit because of the lack of sleep. When more demand is placed onto their brains, they can't handle it because they're tired. And then you get the teacher saying, oh, little Johnny, he's not paying attention in school, or he's not interested, or he's looking out the window daydreaming. And so that could be a misdiagnosis because it could be due to the tethered ties and not due to anything else.
Speech, they were like, he should probably be evaluated for speech just to make sure. And they evaluated him. The evaluator through the public school said he was fine, but then we had him privately evaluated by someone who does myofunctional therapy, who knows the tongue well, and was like, oh my gosh, the two letter sounds that he has trouble with are completely related to the tongue not being able to move. L and R sounds. And so she was like 100%, he needs his tongue released in order to be able to make these sounds. So that set us down a long road of miles. Yeah, we were doing myofunctional therapy, and then prior to the tongue release, and then COVID happened and everything shut down. And then we finally, it was May 2020, he got it released, and we did see major differences right away with the L sound. Much easier for him to say the L sound. And then we continued with speech and myofunctional therapy.
Yeah. So can you talk about, going back to the cranium, can you talk about how the cranium plays a role in this overall?
Yeah, so if we look at the palate, and we oftentimes, because that tongue got tethered down, remember we were talking about the palate and the formation of it, that palate the infant will be born with a high palate, a bubble palate, sometimes we call it high bubble palate, narrow palate, and when that happens, that creates a huge space. So even after the release, when the infant's trying to suckle, they have this big space here. So they're going to draw in more air, which might cause gassiness, right? It might cause clicking. And so in cranial work, we're dealing with all the bones are connected to one another. There is one bone called the sphenoid bone right in here, goes across the skull, that connects to almost all the other bones of the skull, but the palate, the maxilla, is part of that system. So when we're working with that cranial system, we can work to relax and improve the shape of the palate, as well as after the release, the baby's tongue is going to be lifting up and resting there, hopefully, in sleep, and their mouth is going to be closed, and they're going to be breathing through their nose. If we were to look at the spine, we can see that the brain, for example, is the only system or the only organ in the body that's totally encased in bone. It's very, very important. So the brain then sends signals down through the spinal cord and out through all these nerves at every level of the spine to supply and function every single organ in the human body. If there's any interference to this system or to any area or to any of the nerves, it's going to decrease the functioning of that organ, system, tissue, cell. So,
can you talk a little bit more about the gum disease and cavity aspect of this? When I was very young, I had like 10 cavities at one point. I had to go in and get a tooth extracted as a kid. So,
and how many have you had now?
I don't think I've had any.
Yeah.
Maybe one. So, yeah, I think one. Can you talk a little bit more about that? Like, how does that work, I suppose?
Yeah, so you're a prime example because you've been through this journey. And how much of the time do you think you're nasal breathing?
Probably most of the time.
Most of the time, yeah. So when we're able to, again, not inhale that air that's laden with bacteria, fungus, viruses, etc., you don't dry your mouth out as well. and that just makes for lesser cavities. The other thing is when you are sleeping better and making more nitric oxide, you're not going to have cravings at the same level for sugary stuff and refined carbohydrate stuff. Those all things are bad habits, but they're also cravings that our body creates to stay awake. It's like a self-medication to temporarily stay alert. And you stop needing all of that, and your hormones also change. Hormones that are secreted that are craving that stuff. So there's so many other things that are happening. I also think we make the worst choices when we're tired and just feel less tired.
Absolutely.
Yeah.
Absolutely. Could you talk about palate expanders? I had a palate expander, obviously for a while, or every night and all that stuff. How does that work? You talked a little bit about braces and how that's maybe not the first thing that we should go to. So, what is the role of a palate expander?
Yeah, it's a good question, and I think it's probably one of the most, I don't want to say controversial, but I think people are looking to understand when parents will come say, well, I had a palate expander when I was young. What's the difference now? And the truth is, in some ways they are similar in the sense that there's something either removable or fixed. You had a removable one that you can turn the key and it leads to more expansion and there's more room for the teeth. The ways it's different is that the approach that this functional airway dentistry world has is that it's an epigenetic approach. So what does that mean? Is that you are turning the key to keep up with the body's expansion instead of you forcing the expansion. And that is where the role of fascia and proper tongue posture in exercises and craniosacral work, etc., chiropractic work comes into play. All of that realigning, so actually we can reduce this skull that's split up into many different parts, but it's to show the fact that there are many suture lines in the head and the neck that are connected to the lower jaw and the upper jaw. And there's cerebrospinal fluid here, so every time there's a change being made here, it's also being made here. So this is where our collaborative work comes into play. So all of this is keeping then up, then you're turning the key. Now, in previous worlds, I think you would stay in your expander and then just get out of it and move on to the next thing. Here, you actually stay in it for a while until your whole body is stabilized around it. And the glue is, where is the deep front line fascia, where is the tongue, where is the swallow? All of that determines this epigenetic approach of expansion.
What's interesting is, like, as I've been doing research, is that through research I found out that like our ancestors used to have like perfectly aligned teeth with very well like wide spaces for breathing and just in our mouth. Could you talk a little bit more about why, like, throughout just the generations, why it's become more more common to have problems?
It is really interesting. So why are we narrower? And we think it's our diet. So we used to have room for all 32 teeth, right? And I'm sure you guys know a lot of people who have had their wisdom teeth extracted. I'm one of them. And so when our diets became softer and we're not eating hard nuts and foods that really require chewing, the wear between our teeth stopped happening. Our diets are much softer now. And so we're not getting the wear between our teeth like we used to. And so we really aren't getting that space. And we're also not, when we're chewing and moving the teeth around, we're not getting that broadening. It's just basically, it was a big change in our diet. Seems to be the biggest reason why we don't have room and that we're not growing the way that we thought. With the way we used to.
I was, both delighted and surprised to see that there's a lot that we can do as medical doctors and ENTs in terms of treating things from a functional approach, but a lot of these things are not being taught in the universities and in general academia. So we decided to open the Breathe Institute as a group that was looking at everything related to breathing, okay? From how the facial structures develop to the functional and behavioral components of it.
Yeah, I think that there is a point in which each of these things individually are not life-shattering, life-changing things, and often are things that we look at and it's like, okay, that sucks, but maybe not something that we're going to necessarily have to go out and do a whole treatment for and learn about it. And people generally, it seems like it's somewhat of a trivial thing, but when you bring it all together and you look at the big picture and how these things impact all these different categories, impact your breathing, impact your sleep, impact your nervous system, impact your eating ability, sometimes even speech, we end up finding that this is a much bigger issue than it maybe initially seemed, and because all these different parts of the body are connected and different functions of the body are connected, that when you have one thing is off, everything becomes off.
So when I tell you the story, you're going to understand that how everything is so interrelated.
And so if you're not willing to do your own research and find your own providers to help you down that road, it can be very discouraging, and especially with some of the more intense symptoms that come along with it. Like if you get a colicky baby, and it's just so hard to deal with sometimes. So I think it's unfortunate that there's not more of a education for the providers, so that people can get the help they need faster. I think that you hear a lot of stories, people find out about ties later on in their journey, and sometimes it just creates so much unnecessary and stress, and it could be avoided if we just had more information about it. So
I did learn in medical school was to be open-minded and to recognize that what we're taught in school is only, partially correct. And by having that, basis of, hey, we need to continue learning, we need to continue growing, we need to think about things in a different way, that I was open to the concept of fascia when I started seeing it in my patients.
Any advice that you would give to a parent who is in a similar situation, has a kid, being told they don't have a tie, but nursing issues, what should they do?
My biggest advice would be to be your own advocate. If you don't feel like something's right, and that kind of goes with everything across the board, but do your own research, ask around, just try to do your own due diligence to figure out what's going on. And when it comes to the tie, just getting a team of providers that you can trust, that know what they're doing, to kind of be on your side to kind of help you, because it can be really discouraging and overwhelming to deal with some of the symptoms that come along with it. So I guess just doing your own research and being confident that even if your pediatrician's telling you you're good, but you still don't feel like something, if you don't feel like something's good and you feel like something's wrong, just getting more help. So seeing an IBCLC, whether you're nursing or not, to help with an evaluation, seeing a tie-savvy chiropractor, getting an evaluation at the pediatric dentist, just stuff like that. Yeah, absolutely. And getting multiple opinions, I think too. So you feel comfortable. I think it's you need to feel comfortable with the decisions you're making. So getting multiple opinions kind of confirms that.
If, for example, if I went to another ENT doctor, would they be seeing the same thing?
I really don't think so, unless they've seen our work and our publications. I think that think you're crazy, or you're making something up, or you saw something weird on TikTok, and it would just shake your head and be I gotta go, this is not for me. So I really don't think so. I think most myofunctional therapists are aware of it. I think a lot of physical therapists, chiropractors are getting more in tune with it. But ENT doctors, I think they're gonna look at you like you're a crazy person.
And why is that, do you think? Is there any specific reason?
A couple reasons. So first of all, is a lack of education in this field among ENT doctors, lack of interest, and then also a bias towards the type of research that supports it. So most ENTs and orthodontists are looking for randomized control trials, level 1 evidence, but the evidence basis for things like osteopathy and physical therapy are by nature more case series. And number 2, they're just not that interested in it. They're interested in more head neck cancer, infection, vocal reconstruction, and tongue ties. Some ENTs may feel like it's below them, or not that relevant.
You can stick in your lane and do what you're good at, but you need to collaborate. And you need to be looking out for certain other diagnostic markers before you decide to do the thing you're good at. To be really engaged in your health, really be a part, not a compliant patient, but an engaged patient. So not just doing what you're told or not doing it, but really staying engaged, because it is your body, and it is your body that's going to be the healer, not the provider. Providers there to hold space, give the plans or teach the exercise or do the adjustment, but it's the patient who has the power to change.
But ultimately, it really does depend case by case, especially if we're having a baby who's really not feeding well, not gaining weight. We have to kind of consider all the factors. There's also times that we need to wait, that even if a baby, there just could be some complex things playing a role that we need to figure out first before we go for a release. We don't want to make anything worse by doing a release when a baby's not ready or prepared, or if there's another situation going on. The right support can just make all the difference.
Any advice you'd like to give to like parents or guardians for infants who are like experiencing nursing issues or other airway concerns?
Yeah, I would say that you should follow your gut. If you feel like there's something wrong or something is not normal, definitely follow your gut and keep looking for those answers. I think especially new parents, they're written off so quickly by providers sometimes, and I'm usually not the first provider that people are seeing. I'm usually third or fourth, unfortunately. But I often get like, I knew something was wrong. This makes so much sense. Finally, someone understands what I've been going through. So I just encourage new parents to just continue to follow their gut and try to find providers that align with what you're seeing and your goals. I think that's really important.
I think, the first advice is hang in there. It's, same thing with kind of the words that we use to describe birth, like, oh, you're designed for this. And we kind of apply some of that thinking with breastfeeding as well. There are a variety of challenges that we can run into during breastfeeding. And it would be wonderful if every mom had a support team around them, a lactation consultant, a pediatric chiropractor, a pediatrician that is open to these, kind of, I guess, more holistic approaches to facilitating breastfeeding. But hang in there. It's not the easiest thing. Sometimes there are these kind of, bumps in the road as your body's learning how to do this, as the baby's learning how to do this. It's not always so smooth that, the baby came out and immediately latched. Supporting mom through that process, I think, is what's missing right now. Finding a chiropractor that focuses on this type of care specifically, and going through the ICPA's website, I think, is an excellent place to start with that. But finding a chiropractor that knows about this, that sees this on a daily basis, and that can help to kind of create that encouragement for mom, not only the care for the baby.
I would tell the parent to get a really good team and make sure that everybody is supportive of one another.
And I think sometimes getting these ideas, getting these perspectives can be hugely empowering for moms, to be able to hear, oh, I have choices that I can make here. Not only choices, but I have skills that I can develop during pregnancy that better set the stage for me to be able to accomplish this thing, called birth.
Yeah, it's common, but not normal, we'll say.
Can you talk a little bit about, some of the concepts like, fascia and chiropractic and nervous system, and how do those concepts kind of change over the course of your career, and like those ideas, was it something that was talked about? Was it something that you didn't talk about? So just in that sense.
An explanation of sort of how I got interested in this. The next 30 years is sort of a smattering of continued interest in what is now called integrative medicine. It for a long time was alternative medicine. Then they realized, oh, acupuncture really is useful for pain control. It's used for chemotherapy, nausea, and vomiting. It's useful for some of the neuropathic
parts of pain. Although, speaking to fascia, nobody understands where those meridians are, and the insertion of needles in specific places seems to be effective than just what they call sham acupuncture, which is you put a needle anywhere and see what happens. And my job was to go on to the hospital wards at Children's Hospital and talk to people who were giving alternative medicines to their kids, chiropractor, various nutritional supplements, acupuncture, and understand what their benefits might be, and also inform the medical team what some of the contraindications and problems might be with these kinds of supplements. And
a lot of stuff that we're reading now is on like epigenetics, and there's because of the things that were happening during your generations kind of growing up, and the environment at that time corrupts your genes, and then it passes on to us, and then we get the mutations because of it. So there's a
Can you
whole
hear me?
yeah, I
Yeah.
can
Your mom grew up in the States,
yeah,
and I grew up in Africa,
yeah.
yet we had children with similar issues. I mean, that's what's
No
really
idea.
amazing.
My dad grew up in Malaysia and then Canada,
Yeah,
so I have
it's
no
really
answer for
weird,
you.
though. Yeah,
I have no idea.
really weird.
Yep.
But can I tell you something? The feeling you get when you make the difference in just one patient, or when you look at something and you say, yes, because of me, that doctor changed his behavior, or this hospital changed the way they do billing, or they did the way they manage a diabetic patient. That feeling, you cannot get it anywhere else.
When we have the correct team, we get the best outcome.
What is the documentary about? That's a great question, and I think it's a very broad answer that I'll give you, because there are just so many topics that we researched and we looked over. But when I first started out, I had little to no knowledge. All I knew that I was really interested in the nervous system, but I didn't know about the aspects of the fascia and how that basically connects the whole body. So after we started doing research and interviewing professionals, we sort of came up with this pentagon, I guess I'd say, because there's around 5 points that we were trying to highlight and focus on in the documentary. And these range from the fascia, nervous system, nursing, and for infants, and breathing. And these are really broad topics, because as we went through the process, more categories came up. For nursing, we could talk about the birth aspect of it, which is when we talked to a chiropractor, and he explained how much the birthing process has an effect on the development of the infant and their orofacial development, their breathing, and their airway. So I'd say overall, this documentary is just a guiding light for parents who are struggling through these issues with their infants, whether it be for breathing, for feeding.
So what was your role in the documentary?
Okay, so I'd say me and Yuvan, who we worked through a lot, I'd say, during this documentary. And I'd say our role would be we began with research. So we researched all the topics, got some background through different websites, and then after that we had to compile basically what information we needed from each professional vet. A lot of people aren't aware about this topic, just as I wasn't before. So I think it's important to educate people, especially guardians and parents who are going through this. When they enter or find out about this about their children, they have no idea. They aren't if they haven't gone through it before. So if it's their child, they obviously want to know and care, but where do they get that information from? And often for this topic, parents are dismissed or ignored about the problems of their children, because a lot of people are uneducated about it, which is why I'd say the point of this documentary is to educate the audience, whether it be guardians or just people who should know.
So what were your top learnings in the process? Was there anything that changed your life?
Yeah, there was a lot of lessons that I learned from this documentary, and it kind of just changed my outlook on the people around me and just life in general, I'd say. I have an example. When I was in dance class, I was we had just finished a routine and everyone was huffing and puffing, and I realized honestly everyone around me was mouth breathing, and at first I'd be it's fine, it's okay. But after I'd read and researched, I realized that it's honestly not as efficient as breathing through your nose. So I like told that to everyone, and honestly, like they saw a change in like how tired they were after every practice we did. And it kind of made me like realize that a lot of this is common and like prevalent in a lot of people, like just in daily life, and they just go their whole life without realizing that it's a problem.
So what was your goal with this documentary?
Our goals with this were kind of just to connect some of these topics that we came up with. So, breathing, nursing, fascia, sleep, and I think that, and the nervous system. And I think that, trying to connect these things that are so often seen as separate and not, not looked at kind of from a holistic lens. And our goal really is to find a way to connect these things and bring together the knowledge from all these different spaces and all the different practitioners who work in these different, aspects of healthcare and wellness in general, and bring those together and provide kind of a path for people who are dealing with issues that often, are impacted by all these different, or are impacted by or these issues impact all those different things.
What was your role in that process?
I think I'm somewhat of an initiator, trying to kind of bring people together, put this, bring this idea kind of to life, and I'm very privileged to have been in the spaces with the people that I'm working with, and have the chance to talk to some of the people that I've talked to, a lot of people from a lot of different professions, a lot of different backgrounds, a lot of different knowledge, and I think that I've just, a lot of people, often we don't get to, experience all these different, these different kind of types of information, and I think that I've been in a unique situation where I'm able to meet these people, talk to these people, so I'm very grateful for that.
And then what was your personal motivation? Why did you choose to make this documentary about those 5 points?
Yeah, my personal motivation really is kind of stems from my own struggles that I kind of went through as a kid, and when I was very young, I struggled with nursing, and as I grew older, I struggled to eat and to chew like solid food and food of certain textures, and so I would end up holding the food in my mouth or eating like less, and often be hungry, or and holding that food in my mouth kind of helped. I started to develop cavities, and so I think that there's a lot of that. And then as I progressed, trying to find ways to solve these issues, going to a lot of different practitioners, a lot of different doctors, dentists, and the like, and trying to find solutions. I wore braces for some time. I wore a headgear piece to try to slow down the growth of my jaw and try to even out my teeth, and all of these things ultimately weren't particularly successful. And so I'm trying to find different ways to do this, and I was fortunate to kind of find tongue ties and get an understanding of what that is, and have my release done. And a lot of things about my life have changed, and I think that it's was a pretty huge experience for me going through that whole process, and the tongue tie and a palate expander and a lot of different things. So I think that whole experience was pretty life-changing for me, and I think that's really why I wanted to do this, so that the other people will understand, will be able to kind of come to this and see, their own problems somewhat reflected in that, and have an understanding of the things that they might be going through and really what that means.
Then what would a good outcome look like from the publishing of the documentary?
A good outcome really looks like, if people are, if the people who watch this documentary are, gaining that understanding of what, is going on in their lives or in the lives of people around them, and they're noticing things differently, they're thinking about things a little bit differently, and they have this awareness kind of, some of these issues that maybe they didn't think about before, and how they kind of connect to all of these different things. I think that that's really our goal here, is to provide a source of information, in some ways a guide of, when these things happen, there is this resource that attempts to at least collect all this different information from all these different fields, and as much as possible as we could, and put that together.
Yeah, that's very nice. How did you prepare for interviews, and how did you choose who to interview?
Well, I guess our preparation for interviews often was kind of as really just researching the people that we ended up talking to, trying to figure out what we want to talk about, thinking about the profession and how their profession relates to our topic, and some of the work that they're doing, because obviously there's aspects of all these different professions that don't necessarily relate to tongue ties and fascia and breathing and the like, but there's parts that do, and I think we wanted to focus on those parts and make sure that we're talking about those parts. When it came to choosing who we interviewed, we started small, kind of locally, people that we knew, people that we had, I had gone to, I had experience with, from my own struggles, and I think that from there we branched out and met new people, and often our interviewees were with like recommendations from the people that we did interview, and they would say, hey, this person knows a lot about that. I don't know a lot, but this person knows a lot. And we'd go find that person and email them, reach out to them, try to talk to them. So that was kind of the big thing with this, was trying to branch out and gain the understanding from the people themselves who were working on these problems. They had an idea of who also knew about this.
And then what were your top learnings? Anything that, changed your life?
I think that understanding the complexity of this and all the different aspects of this, even having gone through it myself, I don't think I really realized, the scale of these things and how many people, are facing some of these difficulties. So I think that was a big shock for me, learning that, understanding that, I'm not the only person who's gone through this journey. A lot of people have, and a lot of people are, and I think that we, as a group, learning that there is so much to this, and there's so many ways to solve and ways to work on and ways to improve, wellness and health for people, and so focusing on that and learning about that was huge for me.
Yeah, that's all. Thank you.
Cool.